talking about healthcare, it's about love. The second thing is about, obviously, the money and how people are being absolutely decimated by healthcare costs. And when we talk about healthcare costs, we're talking about what's getting in between us and our doctors, us and the services and the treatments that can help prolong our lives. It is debilitating. We have health insurance companies that are making decisions, whether it's through AI or somebody in front of a computer, because they have these doctors that are essentially looking at your files and saying, oh, they don't really have this, they don't really need this, and denying you services and treatments. And so when she made this video, this sarcastic, dismissive, horrible video where, I didn't realize there were people out there who didn't know that we're all going to die. And she shot the video from a cemetery. Well, all kinds of horribleness and deeply dumb, truly, for her to do this. So there is a tremendous amount of energy in Iowa when it comes to electing Democrats. And I was blown away by some of these folks. And you know what? I have access to all of these interviews, and I feel like some of these, there's several that you can go back and listen to from our show when we broadcast live. That was back on, I have to remember what day it was, because it was like August. It was before, August 14th. August 14th. If you go back to that show, you can listen to a lot of great conversations because we were talking to folks who are running for office or who are gearing up for different races. Dr. Tynus can come on in, by the way. I don't know if she can hear me, but Dr. Kathy Tynus, who actually is a healthcare professional. Hold on, let me see if I can do this. Hey, Doc. Oh, is this a plant you're bringing me? Come on in. Oh, you're bringing me herbs. I see cilantro. Or parsley. All kinds of. Thank you.
Tarragon.
I love this. Thank you.
Rosemary.
You don't have to bring me
oregano.
Are these now, Doc? I don't know if you heard somebody. You can pull that up to you too. Here, let me.
Sorry.
There you go. I love that I started this conversation with healthcare because Dr. Kathy Tynus, who has been a guest of mine over the years, is somebody who has been involved in making sure and really trying to convince our legislators that people who maybe are here undocumented, immigrants who are marginalized in our communities, who are afraid sometimes to go for the healthcare that they need, deserve care. And unfortunately, in the state of Illinois, because of the tactics, the bizarre and just nasty tactics of people like Governor Abbott, who sent migrants here by the busload, only to be a part of political drama, there are folks who work in our communities who deserve health care. Right, Doc?
All human beings deserve health care. I think what the distinction that people are making is calling some people less than human. And that's how they're getting away with doing these things. But if you have a belief that all human beings are sacred, especially, some of the religious people that purport to be Christians believe, then you have to believe that everyone has the right to the dignity of being able to take care of their own health.
Yeah, that's the thing. And I mentioned earlier that our access to healthcare has gotten incredibly bad, just awful. And a lot of that has to do with the profit of healthcare. I don't know if I told you about this. So I had a breast reduction surgery, which is a medically necessary surgery for some of us. I can't believe that as soon as I woke up, the pain from my ear to my hand, I didn't even realize how significant it was until after the surgery. It was gone. I mean, I used to have to walk around. I had to wear a sling sometimes because just the weight of my arm was unbearable, right? I would have to have it like this. I had pillows all over to prop them up while I slept. And so the first time I was supposed to have the surgery, because it is considered, I guess, I don't know, inconsequential to insurance companies.
They might consider it elective.
They might, right? So you have to prove that there's a medical necessity to it. And the whole process was, I won't go through the whole thing.
It's humiliating.
It is humiliating.
It is. I'm on your side, and I'm on that end of it where we're trying to get people what they need through a system that's really set up to deny care.
Yes.
When they talk about managed care, HMOs being managed care, it means that they're managing not to pay for what you need.
Exactly.
That's what they're managing. And they've got a lot of people that they employ whose job it is to deny care.
And they sent a note back to my second doctor. The first doctor, I had to cancel the surgery because the hospital reached out to me 4 days before surgery and said that my portion of the surgery would be $4,000. And I called the doctor's office and I said, if I paid for this out of pocket, how much would it cost? And they said about $9,000. But we charged the insurance company $60,000 in the hopes that we get back $9,000. I was like, how? So then I'm still on the hook for the $4,000. So eventually I went to a different doctor, different hospital system, and I was denied because the note was, has she tried a better bra and lotions?
Oh, my.
I'm not even kidding.
Oh, my. You've got to be kidding me.
For context, and for especially women who might understand this, I was a 34K.
I think men know what that means too.
I don't know. I was sitting there because when I got fitted, I was like A, B, C, D, E, F, G, H, I, J. You can't even do it on two hands. I was a third handful. My life is so much better. I'm so much more comfortable. I wish I had done it sooner.
It makes it easier to exercise.
And then manage weight. Then
yes,
absolutely.
So
the first instinct for insurance companies, for these bureaucrats and the administrators in between us, is denial. It's always, and I guess they figure we'll just give up too as part of it, isn't it?
That's a lot of times in my experience, their initial response is denial for something that is legitimate, and then you have to go through an extra step, and that typically requires a physician's time or a physician's assistant's time. And so if you're busy and it falls off your radar, or you just don't get around to it, that case gets closed, and then you lose your opportunity. You have to start the process all over again. Yeah. And it happens over and over again. And at that point, some people they just give up.
Well, and that's the thing too, and this is what I started the show with, was at the very heart of it. We talk about the cost of healthcare, which is just getting out of control. It is ruining lives. People are going bankrupt or losing their homes. But at the very heart of it is love. You want to live longer, so you're with your family because you love each other. You want your child to be cured or have access.
How about be healthy enough so that you can work?
Yeah.
And pay the mortgage and, put food on the table. That's what healthcare is. It's keeping people healthy. It's keeping people productive, keeping them out of the hospital, out of the emergency room. That should be everyone's goal.
Absolutely.
We don't need more people who are disabled or who are unable to work. We want to keep people who can work working.
Absolutely. And even when you get approved for something, so Declan had to have a major oral surgery. My son Declan, who has severe disabilities, he has a malformation of his, basically the way his skeletal structure has evolved. And so his teeth were some of them were impacted. He had to have the wisdom teeth pulled.
Uh-oh.
And we got a call, again, this was 5 days before the surgery, from the oral surgeon's office saying that they weren't necessarily with the hospital, so they were billing separately. And our portion of the bill was going to be $4,800 that we had to pay before the surgery. Who has it
lying around?
Who has it lying around?
Right.
So now you're asking me to go into debt ahead of the surgery. Just so you know, I did not pay it ahead of time, and they didn't even remove all the teeth, so the bill ended up being less than they had originally said. So, and then by Friday, she said, "Oh, well, we talked to your insurance company. They're gonna." It was awful. It's because
there's a lack of transparency too. So you unlike anything else that you would purchase. You go online, you need a refrigerator, you check it out on Best Buy and Costco and Menards and whatever. You can't do that with healthcare.
No.
There's no transparency. No one's publishing how much they charge for things. And the thing is, it's like buying a used car. They say they charge $16,000, but the out the door price is going to be $9,000 because they put in all these discounts. They figure somewhere somebody's going to pay the sticker price, but the vast majority of people don't actually pay what they say they're charging.
Right. It's so hard, and for some people, is it almost, if they have the financial resources, is it almost better to ask, can we just, how much will it be if I just pay for this visit?
Yeah, I suppose so.
For some people.
Well, so there's a movement called direct primary care that does that. So there's different models of how people do it. Some people call it concierge medicine, but it's basically you're removing the insurance company from the equation, and if you can afford it, they typically will charge an annual fee, and they'll take care of you, whatever you need. So you could come in every day for a blood pressure check if you want to, or you may never need them, but they have your cell phone number, their physician's cell phone number. They have, full access. If they're sick, they're able to come in the same day and be seen. But these kind of models are becoming more and more popular from the patient side, but also from the physician side, because, working in an environment where you don't have any control over, how your practice is run and how many patients you see a day and how the reimbursement is being handled, it's frustrating.
Yeah, it has to be something that also keeps many people from even wanting to be a doctor anymore.
I would imagine so.
Yeah.
Although there's still a lot of people.
Good.
Which warms my heart.
Good. And we've talked about this in the past as well, that because of what's happening with immigration, now we see that the White House wants to go over 55 million visas. Mm-hmm. So folks who are working here, and again, we've talked about how there are many who do want to enter the medical profession, and that's going to have a negative impact on our access to healthcare, isn't it?
There's a sizable number of people in residency training who went to medical school in other countries. And those people, a lot of them are actually U.S. citizens, but there's also, foreign people who went to foreign medical schools. And, there's a limited number of seats for residency training. Mm-hmm. And in the U.S., typically up until recently, you had to have completed a residency in order to get a license to practice here. But that's no longer the case in a lot of states, including Illinois. Illinois passed a law last year that allows foreign medical graduates to work in a supervised setting for 2 years and then work an additional 2 years in a health profession shortage area, so that they're giving back. They're taking care of patients that don't have physicians. And after that, they're allowed to get their license. A full unrestricted license. So we're so excited about it at Alivio because, it's just so hard to recruit primary care doctors in this climate, and maybe especially so Spanish-speaking primary care doctors. So we're looking to participate in this program and bring in foreign medical graduates and train them and hopefully retain them, keep them at our practice, and increase access to care for everybody.
We are talking to Dr. Kathy Tynus. Do you prefer Kathy over Catherine?
No, Kathy's good. Yes.
Dr. Kathy Tynus. She's a former president of the Chicago Medical Society. And
Illinois State's Medical Society.
Yeah. Mm-hmm. I'm looking at all her credentials. And she is now with Alivio Medical Center, which tell us a little bit about the work that you do at Alivio.
Sure. So Alivio Medical Center is a federally qualified health center, which means that we work under government contracts to take care of poor people. So, we certainly take people with insurance. We'll take pretty much anyone who walks in the door, and we accept most insurances as well. We certainly see a lot of Medicaid patients, but we also see a lot of patients who don't have any health insurance at all. And so they are able to apply for the sliding scale fee program. They just have to bring in some financial documents, and they get charged, but it's a price that's affordable for them. And we're able to provide all their lab testing for free. I can do pap smears for free. We can do the stool colon cancer screening for free. So we can deliver a lot of health care for our population. And it's just really wonderful, meaningful work, and I love it.
I'm so happy that you're happy.
Thank you.
You deserve that.
Thank you. It's great. Yeah.
I know that there are people who put off getting medical testing, and whether they get. I just realized I haven't gotten some of these tests that you're talking about in a while. So
I know. I'm same thing behind on my mammogram. So
yeah,
you and me both. Let's do a mammogram day.
All right, we do mammogram day. It's one of the ways that Dr. Tynus and I met. I don't remember when. You think you saw me at the Aurora Roundhouse? Was that?
No. I don't recall Aurora. I think it was.
St. Charles. No, one of the comedy clubs.
Oh, St. Charles. Yeah.
St. Charles.
Yeah.
And I have done material about women's health pretty much, and so for folks who see me, they're like, oh, she's doing the same material. I will say I never get tired of doing it because I always get someone, every single show, I'll get someone that comes up to me afterwards and says that it reminded them that they haven't gotten it done. There was one woman when I was at WGN who had not had an exam, and I talked about some of the situations I'd gone through. I make light of it on stage to sort of make it like universal to women to realize they're not alone. But I was talking about how I've had some uncomfortable situations. You know, I had one doctor, sorry, but here we go. I had one doctor who said, has anyone ever told you have a fragile cervix? And I was like, well, you got a weak jaw. Back off. I don't know what. I was like,
wow.
But it was a learning moment for me because it explained a lot throughout my life, right? With that situation. But others, like one time there was a doctor who, I don't want to get in a small talk, right? It's not like, I don't even know, like small, like I'm not getting my hair cut.
Right.
Literally. Right. And she's like, so what do you do for a living? Like, well, she's got a
examining
shoehorn
you.
in me.
Yeah. Oh, wow.
I don't know what that thing is called.
The speculum.
The part that pops you open?
Yeah, the speculum.
That's a speculum? Okay, that thing. She's like, so what do you do for a living? And I made the mistake. I hate telling people I'm a comedian. And her head popped up and she goes, oh, do I have stories for you? I was like, no, I don't think I want any of those. I think that you should possibly go to an open mic. And
I think the only thing that's worse is when the dentist tries to ask you a question when they got their fingers in your mouth. You're like, what do you expect me to do, man? Come on, you do this all day. You haven't figured it out? I can't answer you.
Oh, my God. Which now brings up another element, which is I don't understand, when did we separate oral health from our entire health? Like, was it always the case? It never was merged? Because I know for a while in Illinois, at one point, and I talked to a lot of legislators about this because it had to be reinstated for all kids. They had separated out dental health. And then it turned out that people were coming to, then they were having heart conditions. They were having other issues because they weren't going to the dentist because it wasn't covered.
The teeth are in your body.
Yeah.
It's not like gateway. It's not like you can take them out and, put them in a dishwasher and clean them. Although I suppose you
could.
You get to a point you can.
That's the way you wash them.
Right. No, but it's like Medicare has been like that for forever.
Yeah.
Until recently. Medicare didn't cover dental.
Right.
So,
Well, I don't know if that's on the end of dentists, like their lobbying arm, because I remember I had a dentist for the boys at a nearby hospital, and it was so weird. Sometimes you get people in the medical profession who launch into an entire tirade about the bureaucracy or the element. Like I had one orthopedic specialist who said he was so tired of patients who were on All Kids and then pulling up in nice cars. And at the time we had like a Honda Odyssey, and I was like, well, I bought this, I'm still paying this off from before my husband lost his job. Like, so what? It was such a weird commentary.
You shouldn't have nice things.
Exactly.
Yeah.
And
you don't deserve it because, you're poor.
Yeah, because you're getting services that you help pay into.
Right.
Your entire life.
Right. That's so backwards.
And then the dentist was telling me about how, like he didn't like being involved in insurance, dental insurance and all that stuff. And I was like, can you tell me if my son needs any dental care? Like, how do his teeth look? I'm not here for that.
Right.
I got a lot of other things going on.
Exactly.
Yeah. I think it's been a long time since we talked about this. I kind of know a little bit about your story, but I want to introduce you again to our audience. Dr. Kathy Tynus and I, as I mentioned, we met over comedy, and then we reconnected at an event for the Gift Theater at Old Irving Brewery. That's where I think I met John for the first time, or maybe re-met him. And then I had the pleasure of having you on my show many times and collaborating with you and enjoying fine food and drinks and music with you over the years.
Yes.
So tell folks, what inspired you? How long have you wanted to be a doctor?
Oh, wow. That's the Wayback Machine. So I had a kidney infection when I was a young girl. I was, I think, 9 years old. And I had to be in the hospital. I had to get IV antibiotics. And, it was, it wasn't a horrible experience. It certainly was frightening, but it made an impression on me. And I remember after coming home, I still didn't really quite understand what happened and what was going on. And my mom, who's a nurse, she drew a diagram of the kidneys and the ureters and the bladder and the urethra. And she said, and this part had an infection. And I was blown away that my mother knew what was inside my body. And I just was fascinating with the idea that, you could understand how things work in your body and you can fix things in your body. And that was the seed.
That's wonderful. And I know that my mother she's coming back to see you next month. And I know that she was absolutely heartbroken when you moved and she didn't have access to you. And you are just incredibly kind and mindful of how people receive care and why they're there and what they need. And so, and I love that you communicate that as well on the show. And someone just texted in, what does Alivio mean? The title of the
Healing.
There you go.
Alivio.org, Alivio, if you're interested, alivio.org. We have 7 locations, 3 standalone clinics. We have 3 inside high schools, and we have 1 dental practice inside of another practice.
I love that.
Which is my ex-husband's practice, which is a whole nother story.
Well, it's his story. Again, we're hanging out with Dr. Kathy Tynus. It's Alivio is the name of the wonderful clinic that she works with in the medical center. It's Alivio Medical Center. You can go to alivio.org. That's ALIVIO.org for information about their locations. You can find a provider there and all the different services that they perform. Before we go to the break, because it's a Saturday, so I only have to do half hour. I can do whole half hours.
Ooh, nice.
And again, I'm filling in for Edwin Eisendrath, who is off today. I'm Patti Vasquez in studio with Dr. Kathy Tynus. And before we go to the break, what are your thoughts on the funding for places like Planned Parenthood? Because you mentioned that Alivio works with people according to their income, and that's what happened to me in my 20s when I went in for a pap smear. I was always good about but I did not have health insurance. This was 1994, and I went into Planned Parenthood. Got my pap smear, had abnormal cells, and they were able to, it was $117 to remove precancerous cells so that I might someday have healthy babies.
That's fabulous.
And so,
thank goodness.
What are your thoughts on them defunding and eliminating services like that?
There's such a focus and this religious mindset that really does not respect women's autonomy and has a disregard for women's health. And, reproductive health care is women's health, and women's health is human's health. And it's, to say that they're trying to eliminate abortions or whatever it is, there's so many other services that Planned Parenthood provides. And, they're already regulating state by state access to abortions. They should still provide access to pap smears because it could be their wife or their daughter or, it's just unbelievable to me that, but the lack of empathy in this country it astounds me every single day. I just don't understand it, and it breaks my heart.
We are talking to Dr. Kathy Tynus. Hey, Paul, can we open the phone lines in case folks have questions for the doctor? Because I want to talk more about women's health in general, but we can talk about a lot of different topics. 773-763-9278. I remember I promised a listener yesterday that I wasn't going to save the calls for the end of the show because usually Edwin has like half-hour segments with all folks from all over the country, and then he leaves the last half hour for callers. So I thought I'll open it up because just maybe they got stuff to say to us. More after this on WCPT 820 Heartland Signal.
Check up on health with Chris Whitting.
In theory, designated drivers save lives. But Dr. Adam Barry from the University of Florida conducted a study that will probably shock you.
On 6 distinct Friday evenings from between 10 p.m. to 2:30 a.m., we did what we call intercept interviews. Stop people as they were leaving bars, and we gave them a real quick, kind of structured interview. And then after that, we breathalyzed them using the same equipment that a police officer would use should anyone be pulled over. About 35% of designated drivers had been drinking.
Dr. Barry says it's not unusual for a designated driver to think, hey, I can just have 1 or 2 drinks and I'll be fine.
Oh, sure, and I think a lot of people probably have that conception that, I can have a few drinks and I'll be just okay. And, that's just a really slippery slope. And that's the reason we really recommend that if you're going to drive, make sure that you don't drink at all.
With Checkup on Health, I'm Chris Whitting.
Chicago's Progressive Talk, WCPT 820, where facts matter.
Picture with Edwin Eisendrath on WCPT 820.
Thank you so much for joining us as we continue to drive it home. Paul apparently did get the phone number for our guest on the line. Just a second. We're in studio with Dr. Kathy Tynus, who is joining us joining us in general, talking about all things medical related, as well as other things. And she is with Alivio, a medical center. That's alivio.org for more information about the work that she does. And let me bring up our guest who's joining us, because there's an event. Did you ever study abroad or have an opportunity to do any exchange programs?
I did in Italy.
Did you really?
Bari, Italy.
What program were you with?
It was an exchange program in medical school, and they sent Italian medical students to stay with us for a month, and myself and one of my colleagues went there for a month. We stayed in an Italian dorm, and it was interesting. It was so much fun.
Griffin's actually in Italy right now. He's doing a living history program in Florence.
Oh, wow.
So he's there for 3 weeks, and I'm very excited about that.
What a great place for that.
Right?
Wow. The whole place is like a big outdoor museum.
I know. I just watched a video the other day, and I was like, I want to go to Italy. It seems beautiful. Well, we have two guests on the line. We have Vicci Rodgers, who's a volunteer with an organization that is essentially an exchange program for students from all over the world. And I know that we want to make sure that folks know about this organization. And we also have on the line with us Amir Nasser, who's from Cairo. Thank you so much for joining us today, Vicci and Amir. How are you both doing?
Thank you.
And
Doing good.
Amir, remind me how to pronounce your name. I don't want to mispronounce it.
Yeah, hello.
It's Amr?
Yeah, it's Amr.
Amr, thank you so much. Vicci, tell folks about the organization and let us know how folks can get involved.
AFS actually used to be called American Field Service, so people who have been around a while might remember that. But now it's called AFS Intercultural Programs, and it's been around for over 80 years, since the early wars. But the purpose is to promote international peace through high school exchanges initially it was between the U.S. and other countries, and now it's between countries all over the world. So we are kind of a flagship umbrella, and we bring in students that apply through AFS, as well as students that come in through other sponsored programs like Flex and the YES program and other programs that hopefully will continue to be sponsored by our State Department, but we'll see.
And this is going to be a challenging time. Amr, tell us a little bit about yourself. What drew you to this program and want to come to the United States to study?
Yeah. So I applied for this program from like a year and a half. So I do all the preparations and all the things from like a year and a half to be here. So I started with like an interview and all this stuff. And the reason that I wanted to come here is to see how the life goes here and what the American culture, to see the American culture, to be in high school with another students, and to make like international friends. Like I wanted to see how everything goes here. Like and I wanted to share my Egyptian culture with another student, and to make them know about my Egyptian culture. Like when I talk to somebody here, like he's telling me, "Oh, you're living in the desert and you're going to school by camel or something." Yeah, but I'm telling them, no, I'm living in a city, but I live in Cairo, Giza. So the pyramid is like 15 minutes away from my home.
Oh, wow. Cool.
Yeah, and at some point we can see the pyramid from the balcony or the roof.
Love that.
Yeah, but I told them I'm not living in a desert. I'm living in a city.
How long have you been in Chicago?
How long?
Yes.
Yeah, I arrived from 2 weeks. I arrived at 7th August.
Okay. Wow.
Yeah, and I've been here for 2 weeks, I guess.
Okay, and so what did you think? What were your ideas or what you imagined about Chicago? How did that contrast with your experiences so far here over the last 2 weeks?
Oh, actually, Chicago here are so cool. Like everybody here are so nice and so helpful. Like when I entered the school, the first week I was so lost. Like I couldn't understand everything because everything is so different from how it goes in Egypt, like in school. But actually, everybody was helping me reach out to my classes and are welcoming me. Like I was so happy. And this week was my second week, and everything is becoming better. Like I feel like so much confident, and I make a lot of friends. Yeah.
Oh my gosh, I'm so excited for you, Vicci. Are we able to ask which school, or do you prefer to keep that off the air?
No. No, shout it out.
Yeah, Albert, where are you going to high school?
Yeah, I'm in OPRF, Oak Park and Airport.
Hey,
Nice.
that's what a great community too. Tell
Excellent.
me, what do you want to tell us about your family that you've learned, that you're staying with, that you've learned so far?
Yeah, I'm staying with my family. I met them when I arrived. They are so nice. Like I love them so much. Like they make me fit in so quickly. Like we did a lot of things. I met their family like in different places in Chicago here, and we went to the downtown. We went to Millennium Park and see the beam and that thing that's so famous in Chicago. Like it's just the beginning, and we're having a lot of fun.
Oh, I love when people come to Chicago and fall in love with our city. I'm super proud of that. What has surprised you the most about being here?
What has surprised me? The weather. I didn't expect like it will be at first like so hot weather. Like, it's not.
Just wait.
Yeah.
It'll be cold soon.
Cooler now.
Yeah, we were laughing because yesterday really felt like it was summer for the first time in weeks because people were outside, they could enjoy it. It wasn't so muggy out, and so we do. It's beautiful when it's summertime. I feel like Vicci, we're gonna have to talk to Amr again when in the middle of winter, maybe in February.
Actually, the weather these 2 days, like it's becoming more cooler. Like I feel like I'm so cold when I wake up to go to school. So
right, it's such a contrast.
That's amazing. Now,
Yeah.
I love this conversation so much. And Vicci Rodgers is a volunteer for AFS. Amr is a student who's visiting from Cairo, Egypt. And I know that you have some students that have been approved. They've passed all the tests. They've gotten cleared. However, we are talking to you today because there are some students who don't have families to stay with yet, correct?
That's right. They have scholarships. Amir, talk about some of the people back in Cairo.
So we on the YES program, we are like a lot of students from Egypt, but there are some waiting in Egypt right now to get their placement and to come here and to experience this good experience. Like it's really good opportunity to be here to see the American culture. So they are still waiting. Like we worked, as I told you, like for a year and a half, and that's really a long period. Like they worked so hard to be here, but they are still waiting in Egypt to get their family and their placement. Yeah.
And how can folks, and you need folks hopefully within a week, correct, Vicci?
Right. The window's closing quickly. The schools are ready to accept them. We have probably 20 schools now have our students, and then other schools are waiting. And we just need host families right now, even if it's a welcome family, so these kids can get on a plane, come here, and start their year abroad as ambassadors.
What was it, Amr?
What?
I thought you said something else as well to chime in. So Vicci, how can folks reach out if they are able to provide, housing and welcome somebody into their family from another part of the world? What's the process like?
Well, at this point, it would be good to get in touch with one of us locally as quickly as possible. For more information, they can go to afsusa.org. And then we can post local connection, Patti, here.
Okay, that's great. And do you have is the event that you're having tomorrow open to the public, or is that kind of a celebration and a meet and greet for folks in AFS?
It's mostly our volunteers, but if someone's interested in hosting, they should come, because we literally will have students, we'll have host families, we'll have returnees like myself, and that would be absolutely wonderful. So it is going to be at Harms. Let me get you the address right now. It's actually in Skokie.
Yep.
So it's going to be from 2 to 4 o'clock, and there's all students from 43 students from 19 countries, plus all their host parents will be there. So if you want to know what it's all about, that would be a great place to find out.
And is the event listed on your AFS.org website?
It is not, but I'll send it in to you, Patti, right away.
Excellent. I appreciate that.
Because it's a local.
Yeah, I love that. And Amr, I would, if we have the opportunity, Vicki, if we can arrange for Amr and maybe a couple other students again. I loved meeting everybody last time that they were able to join us in person. I want to find out how your school year is going down the road, maybe in the second part of the year. Sound good, Amr?
Yeah, sure. I would love to.
Yeah, I'm excited for you. And Vicki, I hope that you're able to find some families. Again, folks, there are students who are waiting for placement so they can start the school year here in the Chicagoland area. If you are able and interested, please go to afs.org. That's A, F as in Frank, S as in Sally.org and become involved. And if you aren't able to open your home, you can support the work that they do and learn more. Right, Vicki?
Yes, and go to afsusa.org. It'll be a faster link for them.
Oh, excellent. afsusa.org.
Mm-hmm.
Excellent.
Thanks, Patti, so much.
Oh, my pleasure. Anytime, and have a good time. Are you going to do any sports? Are there any extracurricular activities that you're interested in doing at school?
Yeah, I'm doing American football after school.
I love it.
Awesome.
Okay, hold on. What do you think of that so far? Had you ever played before?
I played this Thursday, and it was so good, so cool, and so energetic. It had a lot of teams, but I'm so happy to be in it.
Oh, go get him! Do you know what position you want to play so far?
I'm a receiver.
Oh, nice! So you're fast.
Wow.
I love it. Well, enjoy, and I look forward to hearing how the season went for you. Okay, my friend.
Yeah, thank you so much.
Thank you. Oh, I love it, Vicki. I love the work that you and all the volunteers do. Thank you for reaching out to us and educating us about the program.
Okay. Thank you guys for loving us. We hope everyone will find out more information and think about opening their homes, too.
I agree. And it really, afsusa.org, folks, to learn more. Have a good afternoon. Enjoy the weather. Get out there. It's beautiful out.
Yeah, thank you.
Thank you. Bye-bye.
Okay, bye-bye.
Bye. Isn't that great?
Oh, yes.
I think that I feel like growing up, there's so many things looking back that I didn't know. This has been around, as she mentioned, for decades.
Right.
You know, I think my parents I don't know if they would have opened their homes for somebody else. We had a very small living situation. But I would have loved to have gone somewhere, I think, for a year.
Oh, absolutely.
Although, thinking back, do you think, because I was very malleable to friendships and FOMO, even though we didn't know, I was afraid of missing out on my, I would be, junior year or senior year. I probably would have done it because I didn't do it in college because I was dating a boy who told me he wouldn't wait for me. And I was like, okay.
I don't know. It wasn't on my radar, but, my husband did it. He purposely picked his law school because he could do a year of his law school training in London, and this is how smart he was. And he left a lot of his classmates behind. They wouldn't join him because they didn't want to miss the football games.
See,
and he was like, "Are you kidding me?"
Yeah, and I was like his friends.
Okay,
right? I mean, maybe if I probably in grad school, but whatever. It's hindsight, right?
It's always 2020, but we're going back to London. We're going to go visit. He also spent time working for a member of parliament who is turning 90 in October.
Oh, wow.
And we've kept in touch. My husband, he keeps in touch with everybody.
Yes, he does.
If you have him as a friend, he's your
Yeah.
friend for life. And we're going for his birthday. We're going to go visit him because who knows how much longer he'll be around.
Yeah, that's lovely.
Isn't that great?
I love London. I really do. We have, let's get to Jim. And hold on a second. Usually I have breaks. And so when I have guests on, I get to say thank you and goodbye off the air. But we have a half-hour segment. So thank you, everybody. Let me get to, hold on a second. Let me get to, I didn't mean to hang up on it. There we go. Hey, Jim, you're on with me and Dr. Kathy Tynus. What's on your mind, my friend?
Hello, Doc and Patti. The Cairo student reminded me of what the Republican Party thinks of Chicago. Obviously, they don't have the same impression that he got from Chicago people.
Right.
They post things that are, this is the most crime-ridden slum in the history of mankind. And I was going to mention this, doctor. I remember a couple of German doctors talking about the pay scale in Germany. And a young doctor starting out was getting $250,000, and a doctor who had been around for a while was getting $500,000. That was the pay scale. Now that's going back 20 years ago, so I don't know what it is now.
Wow.
But the point is, they've had single payers since before the First World War. In fact, Lloyd George would stop when I'm in the street and he said, "What is that card you got?" "Well, that's my health insurance card." So they've had it for over 100 years. And the other thing is, so I mean, we'll get there someday. And as you said, doctor,
yep,
Medicare for all.
Empathy seems to be. I don't know. Maybe it's something you're born with, but it seems to be really losing steam. The other thing is, how about this MGM production with Maxwell, the greatest fiction on earth? She comes out and says, "Oh, I didn't see Trump cross the street. He wouldn't jaywalk, as far as I'm concerned." In the meantime, she got, she put in the prison where she could play tennis. Now, this is a woman who trafficked people. And not even for money, apparently, because they certainly had all the money in the world for some demented pleasure of hers.
Well, if you read, I've never been a conspiracy theorist, but some of the things I'm reading are linking Maxwell to spy organizations, to the CIA and to Mossad. She and Epstein, apparently her dad, Robert Maxwell, was involved with the espionage world, and she kind of just took over, and they were using this as leverage to control people.
Yeah,
it's not. Some of it was
that's
about
why the FBI. That's why the FBI won't release those videos and so on and so forth, because it would demonstrate how many morons are amongst us. How many people that are looked up to or in positions of power that are really evil people, and they apparently can't do that. But this production is ridiculous. That was his lawyer. That's Trump's lawyer giving her
keeping her quiet. Keeping her quiet.
But tell that Trump never jaywalked in his life. He never jaywalked in his life.
And I think it's not even really about protecting Trump. It's about protecting our government's complicity with what he was doing.
Well, we should know. We should know this, and this should come out like the Watergate tapes or Ellsberg's tapes or anybody else that's got germane information. And anyway, you guys have a great Saturday, and good to hear you, Doc and Patti, and good to hear you. Take care, guys.
Jim.
Thank you.
Nice hearing your voice. Thank you.
Thank you. I've gotten so many people on the Patti Vasquez show page where our following is growing. So thank you, folks, for enjoying what we share. That's both myself and a lot of other admins on the page who share news stories and sometimes humorous posts, sometimes thought-provoking posts. There was one, as I mentioned earlier, about healthcare. We'll come back to that in a moment. But this idea that people are like, Maxwell already answered the question. He sent in his own previously his own personal lawyer. So basically, we investigated our boss and we found nothing.
Right.
Yeah.
Right.
Okay.
The employee of the boss investigated the boss.
It's like HR.
Yes. It's like
basically HR.
Interesting.
That confirms everything we already told you. Oh, okay. Excellent. Yeah.
The cover up of the century.
Yeah, and they've already said that she's a liar.
Right.
On the record,
Right.
she has lied in court and under oath. So I don't understand why this is somebody.
Now we can believe her. Oh, okay.
Oh, okay, exactly. One of the things that somebody posted, we shared a story about how much rural communities are going to be impacted by the big brutal bill. In Illinois alone, there are 93 senior care facilities that are vulnerable to closure, 9 rural hospitals that are likely to close around the country. We know that there's already 9 hospitals nationally that have closed ahead of because the healthcare providers, the medical facilities have to look forward, right? They have to look at their spreadsheets and go, well, if we're not going to get money in 2026, there's no sense in prolonging what's going to happen in a year and a half if we're already operating on a shoestring, if not in the red.
Right.
So they're closing ahead of it.
Right.
And so this is what I was talking about earlier. There's this sort of, I guess the memory of what healthcare was like when we were kids, or even in the 70s, 80s, knowing that it was starting to get worse. It was tied to your employment and, the sort of bureaucracy. Actually, one listener texted in, we were talking about Medicare and Medicaid. Let me see if I can find there's a difference between Medicare Advantage versus Medicare Advantage privatized. Oh, they privatize those private doctors with dental and things like that too, which has been burdensome for a lot of folks too.
It's an increasing trend where Medicare patients have been choosing Medicare Advantage programs. The Medicare Advantage is basically an HMO. So you go from traditional Medicare, where to me, when I see Medicare, that's by far the easiest for me, because I know if I order something or refer somebody to somewhere, it's going to be covered. I don't have to jump through hoops. Medicare Advantage, again, it's the old HMO system that we didn't like back in the 90s, but now we're doing it to seniors who are the sickest and the least able to navigate a complicated system. And now you're taking these sicker people and making them jump through hoops in order to get what they need. And, it's to their detriment. And, the Medicare Advantage was supposed to save money, but these private insurance companies are siphoning off millions, billions of dollars. And they're basically going to, because it all comes out of the same pool, the Medicare Trust, they're going to bankrupt the system because it's going into their shareholders' pockets.
Yeah. Yeah. And there's no stopgap to that. There's no.
Well, people need to understand. And right now we have a choice.
Right.
Wait, they're talking about in Project 2025 making Medicare Advantage the default. Yes. Wow. That's coming. Coming. So already more than 50% of Medicare eligible patients choose Medicare Advantage programs. I understand why. There's a lot of time there's zero premiums. Okay. So they lure people in, 0 premiums. They get their dental covered, they get vision covered. But when they actually need something serious, some substantially expensive thing, then it's a problem. And there are a lot of co-pays, and their out-of-pocket goes way up. More so, with traditional Medicare, you typically was an 80-20%. Medicare pays 80%. You pay 20%, and you purchase a Medigap plan, and that covers your 20%. And for most people, that system worked seamlessly. They got everything they needed. Did not have to pay exorbitant out-of-pocket costs. But now with the Medicare Advantage plans, patients they're developing sticker shock.
Yeah.
And it's difficult to go back because the Medigap plan that I talked about, so by law, Medigap plans, and it's regulated state by state, within your first period of Medicare eligibility, they have to provide you coverage without any kind of, medical vetting. So anyone who applies for a Medigap plan who's 65 and newly Medicare eligible has to be accepted, and their premiums are typically affordable. If you go to a Medicare Advantage plan, you're no longer in a Medigap plan, and you try to go back into a Medigap plan, guess what? It's like any other insurance that you're going to try to get. You have to go through a medical exam, and they look at your records, and they can deny you. Or they can charge you, up the wazoo, as some people would say.
I hate when they charge up the wazoo. It's so uncomfortable. It's uncomfortable. That's crazy.
That's what's happening. And I'm working with the Illinois State Medical Society to get the laws changed in Illinois so that Medigap plans have to cover people beyond their initial Medicare eligibility. And you can do that.
Do you know who's is there legislation yet?
Not yet.
And do you have a sponsor, like a legislator that you're working with?
I'm not that far yet.
Okay.
This is just a plan.
I have ideas.
We've hatched. Okay.
Yeah.
Okay.
I have really good ideas, and hopefully she's amenable to working with you. But she's a fire. She's just she's got a lot of passion for especially medical related issues. And
Great.
That's, I don't know if I should say her name on the air in case she doesn't want to do it.
Okay.
So I'll tell you
Put her
off
on the
air.
spot. Yeah.
Yeah, exactly.
Like, you don't have a choice. Sorry.
Yeah, exactly. So I'll let me know if you need a connection.
Absolutely. Thanks.
Yeah.
Take all the help I can get.
Of course. And I think that it's as I mentioned earlier, it is such a confusing process to get through, to navigate all the different, the denials, then appealing and all those things. So what we had posted, and we have friends at a media organization called Barn Raiser. They catch a lot of the rural stories, amplify what's going on in the heartland. And so there's a story called Band-Aid Care when keeping rural people healthy requires what's happening with my mouth today, requires creative solutions. And the reaction I got from one person, this is what he wrote: the rest of the world, including the U.S. as a whole, don't owe you anything. Medicare is state. Complain to your governor. To which, I mean, that's such an easy thing to find out.
That's
not true, right? So I just wrote, and I like thinking I sound snarky, right? So, and I hope that they hear it in the voice that's intended. In fact, darling, because whenever a guy talks to me, I always call them sweetie or darling when they're being that condescending.
Oh, okay. All the men out there, take note.
Yeah, when they get condescending with me, I'm like,
that means she's pissed at you.
Going grace does not mean that. It means go and do something to yourself.
Bless your heart.
Bless your heart. Yeah. Medicare is a federal health insurance program, not a state program. It is run by Centers for Medicare and Medicaid Services, which is CMS, which is run by who now?
Oh my God.
Dr. friggin' Oz.
Oh God.
Yeah, who also wants to destroy it. He thinks that he has said that health care is not a right, that it's something that some people should have. He wants to have basically these flea market type events, these fairs where you kind of like rotate, like you have a station for blood pressure. Apparently, I don't know, do you have a colonoscopy behind a little curtain? I have no idea.
I hadn't heard about that. That's crazy.
Oh yeah, that's what he wants to do. That was even before he was approved by. Yeah.
Oh wow.
So at any rate,
he's so embarrassing to us.
Oh my God! I mean,
to me as a healthcare professional, yes. I'm embarrassed.
And then so the response I got was, "Well, my dear, I'm almost 70, and I can tell you in the past the states used to cover Medicaid." Which is also is entirely not true. It's both. It's always been federal and state.
Right.
The federal government didn't until Obamacare infected our states with socialized medicine. Come on now. And then he goes on, and I don't know why I felt I had to like defend myself, because he goes, I had the greatest medical staff and lost everything because of them, because they refused to accept, right? And he writes, remember the Obamacare shift? Probably not. You're really young. By the way, you are misspelled.
Okay.
EYOUR.
Okay. That's all you need to know.
I'd do anything to get that Medicaid back, not the garbage they're selling us now. But I love that, like, to be clear, I'm 16 years younger than him. That I would be, I wrote back, I'm like, I was born during the Vietnam War. Nixon was still president, and I saw Jaws in the theater, which was really inappropriate because I was only 4 years old. But
ouch. That has to leave some scars.
Emotional?
Yes.
We actually left. I have 10 seconds to tell you the story. We were in the Wisconsin Dells, and they apparently thought it was a big summer movie and didn't do further research. But the girl is swimming, like the first swimmer, with her legs are underwater, and you hear dun, 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 dun. And my mom goes, okay, let's go. And we left. Let's take a break here. We'll be back in a moment on WCPT 820 Heartland Signal, in studio with Dr. Kathy Tynus.
When I'm in the car, I'm always listening.
Driving it home with Patti Vasquez. Patti Vasquez. Weeknights 5 to 7 on WCPT 820.
NBC News Radio, I'm Lisa Carton. President Trump says he'll know if he's made any progress towards peace in Ukraine soon.
2 weeks, we're going to find out which way it's going to go, and I better be very happy.
Trump has attempted to broker a peace deal, meeting with Russia's Vladimir Putin, then with Ukraine's Zelensky and U.S. European allies. Friday from the White House, Trump was asked about new Russian strikes against Ukraine and said he wasn't happy about anything with the war. Gilmar Abrego Garcia could soon be deported after being released from a Tennessee jail. Attorneys for the famous immigrant were notified Friday that he could be deported to Uganda as soon as next week, even as he awaits trial on human smuggling charges. After his release yesterday, his lawyer said Abrego Garcia was on his way to Maryland to reunite with his family. He was originally deported earlier this year in what the White House said was an administrative mistake, but then they later claimed he was a member of a crime gang. The Abrego Garcia case has become a flashpoint for President Trump's immigration policies. A police manhunt in Detroit is over following today's arrest of a 53-year-old suspect in the hospital shooting death of his ex-wife.
He got into a verbal altercation with what I'm being told his ex-wife in the basement area of Henry Ford Hospital. He produced a handgun and fired multiple shots, killing his ex-wife.
Police say Mario Green shot and killed Latricia Green Friday morning in the basement of Henry Ford Hospital where she worked. Utility bills are on the rise across the U.S. Federal data shows electricity costs are up by more than 5%, and natural gas has risen by nearly 14%. An analysis from the Center for American Progress shows nearly 60 utility companies will soon increase rates this year by more than $38 billion and affecting over 57 million Americans. You're listening to the latest on NBC News Radio.
This is Chicago's Progressive Talk, 820 AM, WCPT Willow Springs, and online at WCPT820.com, where facts matter.
Are you a parent of a 2 to 8-year-old? Listen closely for an exciting offer, then head to abcmouse.com/radio to learn more. By now, you've probably heard of ABC Mouse.
ABC Mouse is like a little one-on-one teacher. It has helped her so much.
We're offering a promo at abcmouse.com/radio to try it for free for a month, then $14.99 per month until canceled. Go to abcmouse.com/radio to see this offer. That's abcmouse.com/radio. Actual ABC Mouse users compensated for their testimonials, sponsored by Age of Learning.
Because facts matter. You're listening to WCPT 820.
You're listening to The Big Picture with Edwin Eisendrath on WCPT 820.
I hope you're not too disappointed if you're looking for Edwin Eisendrath. He has the day off on this beautiful summer day in Chicago. This is Patti Vasquez, host of Driving It Home, Monday through Friday, 5 to 7 p.m. In the producer's booth, we have Paul Shivari, who is keeping things going. And the phone lines are open if you want to call and join. And we also have the text line open, the Credo mobile phone and text line. And that's 773-763-9278 if you want to join the conversation at any time. Right now in studio, we have with us Dr. Kathy Tynus. She's with Alivio Medical Center, and we were just talking about healthcare, Medicare Advantage, and a listener says that they often advertise on left-leaning outlets in order to, make people think that they are supported by those organizations. Our sponsors do not necessarily reflect the things that we want to say, and so I guess we have to. It is what it is. I will tell you, the sponsors of my show, Driving It Home, all are direct. Like and a lot of our sponsors throughout the entire station believe in these conversations, like Dr. Jason Bissell, David Hochberg, just to name a couple. We have.
I used to practice with Dr. Bissell's sister-in-law.
Get out of here!
Yes.
Have we talked about this?
No.
Oh, what the? That's amazing.
A small world.
It is a small world.
For like 15 years.
Get out of here.
Yes, we were at McNeil Hospital. Dr. Jennifer Bissell, she's currently in practice up north at Northwestern in Grayslake, I believe, in their office. But she and I, we worked side by side for many, many years.
That is so
and
wild.
So I met Jason.
Yeah. He's on my show every month. At the end of the month, he practices acupuncture at Chicago Community Acupuncture right over here by Superdog. I always like to let people know. And so if you want to check it out, Chicago Community Acupuncture is at chicomaku.com. His daughters tell him it sounds more like Chico Maku. That's the way he Com Acu. CHICOMACU.
Okay.
Yes, Chico Maku. It's cute. And it's always great to talk to him. Now, I think last time you and I talked, because he does triathlons. He does a lot of that sort of training. I often talk about how much I hate running. And the last time you and I spoke, you were looking for other ways to work out. Have you found something that you enjoy the same way?
Too busy.
Me too. I hired a personal trainer. I will be honest. So I wanted, because I know that I need to go back to doing some weightlifting, some weight training, and I've been on a treadmill. I do an incline of like 20% incline for like a half an hour while watching Emily in Paris. I only watch the show when I'm on the treadmill.
All right.
Because
yes. That's great stuff. I've been riding my bike to work, if that counts.
Absolutely, you know it does. Yeah, of course.
It keeps me moving, and dancing.
Oh yeah,
you know
dance.
Me. I go to you go to a show and there's some lunatic dancing up in front. That's me.
Same. I'm at a show. People know that if they see me waiting at a bus stop, I might be dancing. Like, I don't mind. I just get it. I love to dance.
I just hear a beat and my foot's tapping already.
Yeah.
I can't help it.
Are you? I know we talked about going to New Orleans together. Are you going to New Orleans again anytime soon?
Not on the. Probably Jazz Fest in May, but no other.
I'm going for Halloween.
Oh, are you?
I have a hotel room if you want to come hang out with me and my friend Heather.
Ooh, that sounds tempting.
I'm just saying.
Okay.
Pam is calling in to talk about Medicare. Hi, Pam. You're talking to me and Dr. Kathy Tynus. What's on your mind, my friend?
Hi. I have a personal experience with my mom with Medicare Advantage. I assume you don't want me to call the name of the company because I don't want to put anybody in jeopardy. But this particular company, my mother had just signed up with, they sent an agent out, signed up with. And I'll give you the short of it. There was a medical procedure needed just as she signed with them, not knowing, unbeknownst to her, they didn't cover this procedure. Mm-hmm. And so I asked them, why would you take advantage of a senior citizen? Why would she even sign up for this service if she knew, or if the family knew, they wouldn't cover the procedure she needed? And so, long story short, I had to write all of the governmental agencies. And after we had to pay up front for her surgery, which was expensive, they did reimburse us. But it took me writing everybody.
Wow. That's what they're doing. And, and so part of it is they narrow the networks. So
yes.
That's, that you sign up with a plan and all of a sudden you can't go to just any hospital. And you can't go.
And so, I'm asking everyone to be really, really careful because I know a lot of people who are signing up for the first time with Medicare Advantage. And then lastly, I'll ask you all this question you can answer. It seems to me that this administration, they want to attack Medicare, but they have no interest in talking about the fraud within Medicare Advantage. Mm-hmm. And I think that's because of the private point of service, the private companies, insurance companies that operate this. And I'll hang up and listen. But this is a discussion that is so important.
It really is.
Because what are we going to do without health care? But thank you all for having the discussion.
Thank you, Pam.
Thanks for calling in. That is so tragic, but I've seen it over and over and over again. And it's true. And, it's really it does a disservice to our seniors who have paid into the Medicare system all their lives. And now when they need it the most, they're being, manipulated and, their care is being delayed or deferred or outright denied and requiring people to jump through hoops. And, God bless Pam for doing what she did to get what was right. But a lot of people, they would just give up or they don't have, they just don't have the, what it takes to fight. And they don't.
How much has it changed for you as a doctor over the last since the first administration? As far as not just like the billing, but even like people's understanding of their own health. Like, because whether it's I was thinking about, the pandemic and how it was not understood by so many people the fact that that president exacerbated the entire situation. There had been essentially a playbook for handling a pandemic, which when he came into office, because it was under President Obama, who it was in part response to the possibility of Ebola, right? And having these communications between medical providers, hospitals, global communications about what was happening where, collecting that data. Are you seeing that, or have you seen that sort of have an impact as it relates to the doctor-patient relationship with the amount of misunderstanding?
There's a lot of misinformation out there, and people are believing it, and to their own detriment. And, when it comes to things like vaccines, it's to everyone's detriment, because we need herd immunity to protect people who are vulnerable.
Right.
There are certain populations of people who can't take vaccines, or if they do take the vaccines, they're not as effective because their immune system's impaired. So, the cynicism I've seen growing, people believing that somehow, like, I'm getting a big fat paycheck when I'm giving someone a vaccine is ridiculous. But people believe it. They're being told this propaganda, and that's why we need to counter that and be out on the airwaves and be out on the internet and talking to people and explaining what the reality is. I mean, we eliminated polio. We eliminated smallpox, because of vaccines. People used to die in childhood. If you walk around any old cemetery and look at the gravestones of all the children there, I mean, it's sad. It's really sad that people are making decisions based on the lies that they're being told, and they prefer to believe those lies than their own healthcare professionals. And that just, it's daunting, and it's frightening to me.
And this is why we dance. I mean, partly, right? Because it's so stressful. I mean, you have to carry so much. It's a lot of weight to want to work with people who are coming in with these preconceptions or with cynicism, with skepticism. And look, I fell prey to it when the boys were little. I have two boys who are now 20 and 22 years old, which is crazy to me. And, with Griffin, I remember my older son, he had to get 4 vaccinations at once, or they wanted him to get 4 vaccinations at once. And Griffin, and now I know as an adult, like, this is just the way his brain works. Like, he relives things, kind of like he internalizes an experience. Like, he was having nightmares for a couple weeks, and so that impacted me, right? So when Declan was born, and there was all this information about there, Jenny McCarthy was very vocal about how vaccinations were causing autism, and there was this huge wave of, and believe me, people talk about, like, I think it was the limousine Democrats at the time. They were talking about how these, like, rich liberals were spreading this information about vaccinations because RFK Jr. was at the head of this. This about merconium or whatever, mercury, not merconium. That's when that was what Griffin aspirated.
Thimerosal.
Yeah, right. I don't know that's how you pronounce it.
Thimerosal. I'm not sure.
Thimerosal. Yes, but he was at the forefront of that. So he was the one. He was on these airwaves.
And the doctor that did the original research in the UK was discredited, and his license was taken away from him because he falsified the evidence in his study. So all of this is based on lies, but people choose to believe it because they want to have a scapegoat. They want to have a reason. And I feel for parents who have a child and they don't understand why. What happened?
Why did this happen? Yeah.
Right. And they want to have a reason. And, it's human nature, but, taking something that's inherently good and turning it around and making it, the perception of it to be something bad is really sad.
And I've been struggling with this for the last few months because I said, I fell for it when the boys were little, because when Declan was born, my younger son Declan was born medically fragile. And it's funny when I say that because I live inside of this experience. I don't know how that sounds to people. And someone was like, what does that mean? For us, it meant that Declan was not able to breathe on his own. They had to bag him. They had to start giving him oxygen. Then They had to put him on life support. He was on a ventilator, and they had to push a lot of medications to get him, and they had to give him surfactant to line his lungs to be able to hold air, to hold oxygen. And he was extremely sick for 28 days. They had to keep him on oxygen. He was able to be weaned off of the ventilator. They didn't think he was going to survive. All kinds of things that were happening. And I remember towards the end of his NICU stay, a pediatrician came in and said it was time to give him his vaccinations. And because of all the information I was getting, because of Griffin's kind of reaction, I was like, oh, do we need to do them all now? Can we space him out? And I mean, will that hurt him? Is he strong enough? Like, my brain was impacted because Jenny McCarthy was on Oprah Winfrey, which was a show that when Griffin was little, I had daytime television on. And
I hate the fact that she legitimized so many people.
Yeah, I mean,
Dr. Oz was on her
Dr.
show.
Phil,
Dr. Phil,
who's not a doctor. I mean, when you think about the chaos, she has led to a lot of this.
Yeah, she did. It's sad.
Yeah, and I was terrified. And so the thing I'm struggling with in the last few months is, for most of Declan's life, we didn't know why this happened. We had some of the, some of the things that I guess anatomically could give us a reason. Part of his brain hadn't fully formed. His corpus callosum was underdeveloped. He had hypotonia. He had all these things, and nobody really knew why. And I was trying to do my own research, and there were some possibilities. I have A negative blood type, Rh negative. Steve is a different blood type, so my body attacks a different blood type just inherently, right? Rh negative attacks other blood forms like it's a tumor.
Right.
So I thought, well, did my body react to having a baby with Steve, and did that, all these, like, for 20 years I thought, was it a broken light bulb that I cleaned up that had mercury in it? Did I inhale it when I was pregnant? I had cats. Was it the
I can't imagine. That must have been torture for you.
I didn't tell Steve about the light bulb until about 6 weeks ago. I would walk past that closet all the time. I hated that closet because I thought that was what had caused Declan's disabilities, right? And then you have all the vaccinations. Did I work too hard? Did I have a virus?
Understandable.
There's a lot.
It's understandable. You don't know what to believe.
No.
You don't know who to trust.
And at the same time, like, I found a path to be Declan's mom. This life that I had not dreamt of for us, right? Because I had dreamt of my boys playing baseball together, playing Batman and Robin, going to school together, learning how to swim, being there for each other. And believe me, Griffin is there for him all the time, always has been, in a different way, in a different capacity as a sibling of a severely disabled child. And so Declan could walk for miles. It was the one thing. He cannot speak intellectually. He is what I guess people would think of as maybe 2 years old, still matching shapes and numbers and letters and things like that. A beautiful little boy, and now an adult. But when he was little, and I don't know if you've ever heard me tell this story, like, I didn't want this. This is a lot. And it was a lot in the first few months, all the nevers, because they told us he was never going to talk. He was never going to go to school like other kids. He was never going to live independently. And they give you all these nevers, which is an impossible place to exist. And if you don't find a way out of it, it can be catastrophic. So I just remember one night, it was dark, everyone was sleeping, and I love my husband, he snores. And so he's snoring, Griffin's asleep, Declan's in the bassinet next to me, and I didn't want to be this person. And I wasn't talking about, like, I wasn't thinking about hurting myself or running away. I just didn't want to exist. I was just like, I couldn't sleep. And all of a sudden, Declan started crying, and I picked him up, and I was holding him, and I was breathing, like holding him. I felt good.
Yeah.
Right. I was like I relaxed holding him, like, this is, and what occurred to me was I was living in never. And I thought, okay, if I can just stop worrying about all the things he can't do and start loving all the things he can do, which was, laughing at his brother and loving music and all these things, that's where I could live. And believe me, I've backslid numerous times throughout his life where I'm like, this is too hard. This is too much. And I come back to it because he is so outrageously beautiful and sweet. He touches the hearts of everyone he comes in contact with. Oh. And so sadly, a few years ago, he stopped being able to walk, and we've been trying to find answers. And so finally someone said, hey, you know, technology's come a long way. Let's go ahead and redo some genetic testing, because they hadn't found anything when he was a baby. And as it turns out, he is one of the few people on the planet with a genetic disorder called primrose. Mm-hmm. And so it's spontaneous glitch in the genetic code. It's not something I carried. It wasn't something that I did. There was nothing we could have done. Steve doesn't carry it. And so now I have context, I have explanations, and I also feel like, this is going all the way back to what you said about vaccinations. People want to have a why. And I, as somebody who wanted that for 20 years and like came up with all these different whys it could be possible, having it is consoling. It doesn't change anything about the way I love my son, all the things that we've done for him his entire life. We did everything right.
It removes the guilt.
It does.
It's huge.
And I don't know how to do that for people who don't have an answer, who want to believe it was the vaccinations, who want to believe it was something. And because it's not fair, I have an answer. So, yeah, only 53 people have primrose.
Wow.
Isn't that, I think I might have.
You were telling me,
a little bit, but isn't that, it's wild.
Yes. Yeah.
And every single person's different, just like in life.
Great. Yeah, it's great. It's great to have an answer, though.
It is.
It's huge.
It is. And so I understand, though, wanting to point a finger at somebody or at something, or it doesn't. And I don't have, because I didn't come to that understanding before we had an answer. I can't. But I was able to manage it. And no matter how quiet you make that voice, I know for many parents, it's still, especially moms, because we carry the baby. Right. It's on us with the and especially what's happening now.
Did I have one too many cups of coffee that, you know? Yeah. I mean, seriously. All the things.
Sugar, tuna.
Yeah.
Right? Yeah. Changing the cat litter box. I mean, there's a million things.
Sure.
Living in a city with too much pollution. Right. Shaking too many hands.
Don't get me started on the sushi. No sushi. Right?
Exactly.
I know. All those things you have to give up when you're
all the
pregnant.
Things. It is all the things. And also they're criminalizing. I don't know if you saw that a woman was arrested for having, she had taken some cannabis during her pregnancy. Her doctor had said it was okay to manage her nausea. And so then she essentially was, I think she lost custody of her baby because they were able to detect there's zero tolerance in the state that she's in for marijuana.
Oh my goodness. And so, who does that serve? How does that help anybody?
See?
It doesn't serve that baby. That baby's going to be in the foster system.
Right.
And, you know, they might get lucky with a good family, but, you know, there's a lot of abuse.
Exactly. Let me get to a text and a phone call. Jill in Evanston says the new premium on original Medicare went up $50 a month for me, more for the hubby. Our second year premium, so almost 50% for one part of Medicare.
That doesn't surprise me. And, you know, the plan is to defund Medicare.
Right.
And so the premiums are going to go up, and people are going to be, having much more difficulty using their Medicare because, you know, they're going to continue to reduce the staff size in these departments, and essentially, you know, you're on your own.
Exactly.
So yeah, I'm sorry to hear that. That's rough. That's really hard to absorb that cost.
It really is. And Dave in Hoffman Estates, I told Dave the phone lines would be open today. How are you doing, Dave?
Hey, Patty. Thanks for taking the call. Like I told you, hi, Doc.
Hey.
Sorry. And I told you I was going to vent this one.
Yes. You go.
And
we'll turn our mics off and let you vent. How's that?
Fair enough. This one is about, as you know, I told you in the past, I'm a Cold War veteran. You know, I don't like to prefix it like you got a caller from Michigan that I was prefixes that he was Vietnam, you know. But I had voted twice for Congressman Krishnamurthy back in 17 and 19 and stuff. And, well, he being an immigrant whose family came to America in the mid to late 70s, the period that myself and millions of us Cold War veterans were in. So I voted him in, and I thought that, you know, he would have a little compassion on the fact that, you know, the country was kept safe by, you know, us. And during that period of time, I wrote him on 4 different occasions asking him to either, why did he not co-sponsor any of these? There was the Cold War Service Medal Acts. And why did he not sign it, or why didn't any of your compadres from Illinois, and they've yet ever to sign one of them, and yet they love the veteran, though, right? And so it got to the point I got to reading in August of 2021. He did co-sponsor a bill by then New York Representative Carolyn Maloney's H.R. 5022. And in this bill, it was to posthumously award Mahatma Gandhi a Congressional Gold Medal, for his actions in peace or whatever. Well, he also was jailed for sedition back in 1903 in England, and that, he was able to do that. But Asta kept the country free so his father could do a business which failed later on, and he could get in, eventually to be a congressman. And after Senator Duckworth, moved on to that open slot because he lost to her before. And then I figured, he's got the largest war chest of all the campaigners, so he probably, he'll buy his votes in or something. I don't know. He'll get in. But and let's not forget, Governor Pritzker and Senator Duckworth didn't endorse him.
Yeah, I mean, I don't know. I don't know that he is a lock. I mean, we've got some ways to go for the primary, which is right now it's Congresswoman Robin Kelly, Lieutenant Governor Juliana Stratton, and of course, as you mentioned, Congressman Raja Krishnamurthy. So far, when I've traveled, it seems like folks are more familiar with him than the other two candidates in other parts of the state. So it'll be interesting to see how this unfolds.
Right. Well, he's been able to flood the airwaves too, because he's got the most money. And now you have been a rep in politics before. Candidate. Thank you. Okay.
Sure.
Now he loses. Does he get to keep that campaign money?
Yeah. Yeah, you not keep, but so I still have some money in my political campaign, and I use that money for like nonprofits that reflect what I believe, what people would have sent me to Springfield for. I use it for farmers markets. I use it for candidates who reflect the values that I believe in. I use it for organizations that, like for Kids Above All, like different organizations that do the work. I don't know if I've actually contributed to Kids Above All from that, but organizations like that. That reflect what I went to Springfield. I would have gone to Springfield for.
Yeah, no, because I asked Jo, and she was going to ask that one lawyer, but I didn't hear. That.
Yeah, it's your political committee money, right? So it's basically for you to run for office or to contribute to other similar political campaigns or nonprofits.
Wow. But anyway, I just always felt after that he just stuck us Cold War veterans in the back. So he ain't going to ever get my vote again.
I'm sorry about that. That's a shame.
So am I. I mean, we didn't do nothing wrong. We won our war. The wall came down. They won't honor us.
Oh.
We deserve it. That all we could get. They still have never got a decoration for us that signifies Cold War guys.
Have you?
Every other one. And all we could get was a Cold War recognition certificate if we wrote for it back in 1998.
Wow. Have you reached out to your state legislators about this?
I tried. They're not to be found.
Who are your state legislators?
Like I say, the only one that ever did anything was
Representative Kifowit.
You got it.
Yep.
Anyway, but
by the way, do you know that she's? Hold on. By the way, do you know? Hold on.
Okay.
Do you happen to know that she's running for state controller? By the way. Representative Kifowit. No. Yeah, she will not run for
got my vote.
There you go. She's not running for re-election for state representative. There are several other candidates. There's also the Lake County Treasurer Holly Kim is running, State Representative Margaret Croak. But I wanted to make sure that you knew that there were more candidates in the field now.
Good.
Yep.
No, Stephanie is going to get my vote because she went the extra mile for me, and I wasn't part of her, in her district even.
Have you had the opportunity to join the group Vote Vets?
I've never looked into it. No, I've heard of it, but I've never looked into it.
Look into Vote Vets. You might find some folks that have some energy behind what you're talking about as well, and have a bigger platform to maybe have an impact on these issues.
Well, I'm hoping with this the blower that we got going on right now that there's a few Cold War vets. I've heard that, and because a lot of them just they don't seem to be. Yeah, it was a time in my life, because we were the redheaded stepchild.
Yep.
Exactly. Anyway, but Patti, thank you so much for the airtime.
Of course. Have a good one.
You too.
Thank
Be
you.
well, guys.
Take care.
Bye-bye.
Thanks. This is Patti Vasquez. This is Patti Vasquez sitting in for Edwin Eisendrath, who has the day off. I host the Monday through Friday show from 5 to 7 p.m., Driving It Home with Patti Vasquez. Joining me in studio is Dr. Kathy Tynus. She works with Alivio Medical Centers. You can go to alivio.org. That's ALIVIO.org. And we're going to continue our conversation because I got a text that is similar to the kind of work that you're doing right now. And I think we should talk about that with legislation and things.
Oh, cool.
Excellent. More in a moment on WCPT 820 Heartland Signal. We're glad that you're here.
WCPT Replay.
Store closings on pace for new record. That, of course, would be small businesses because they're being just wiped out by Republican economic policies, as they always are. 10 of the last 11 recessions began during Republican presidencies. That's not a coincidence. Republicans love recessions. They want the economy to go into the tank. People go, well, why? Aren't they invested in the stock market? Aren't they, don't rich people have all their money in the stock market? Why would they want a recession? Why would they want the market to crash? Well, yeah, they want the market to crash because when the market goes down, it doesn't hurt them, frankly. When the market goes down, what it does is it creates an opportunity for them to buy stock cheap because the market will go back up. Democrats will come back into power and they'll put the economy back together.
Keep listening to WCPT 820 because facts matter.
Hey Google, play WCPT.
Streaming Chicago's progressive talk from TuneIn.
You're listening to The Big Picture with Edwin Eisendrath on WCPT 820.
Thank you for joining us. This is Patti Vasquez filling in for Edwin Eisendrath, who has the day off. He'll be back next week. I host the Monday through Friday show, Driving It Home, and we're in studio with Dr. Kathy Tynus. I know Edwin does deep dives, so we're doing a 2-hour deep dive on healthcare, which I think that a lot of folks consider to be a priority. I know for me, I think it is the crisis of my lifetime, and I knew that at a young age. That like when I was a kid, and my mom hates this story. Oh, I don't know if she's listening. I don't know if she knows I'm on the air, so maybe I'm okay. Because she did not know this. When I was 12 years old, I woke up with a really bad stomach ache. And my mom worked for the federal government. She was, she had an entry level position at the time. She wasn't a computer programmer as she eventually became and earned more money. My dad was a cab driver. We lived in a very small 1-bedroom apartment. They yelled a lot about money when I was a kid. Where's the money for my dad was also an alcoholic. He had a gambling addiction. So it was very stressful in my house. And so when I got really sick, I used to be afraid to go to the doctor. And because I knew that it was expensive. I don't know where I was getting that from. I don't know if it was arguments that they had, but I had a really bad stomach ache, and I could not move. I was violently sick. We don't have to go into details.
Okay.
But so we were on the phone with the doctor, and he was like, try ginger ale, saltines, like whatever. I don't know if it was saltines, just ginger ale. And then finally, because my fever was going up, he said, take her to the emergency room. And I don't know if it was the adrenaline that I was scared that we were going to the emergency room, but we were, I was in an exam room by myself and I was feeling better, and I got scared that my parents were going to spend all this money on taking me to the ER. So I started punching myself in the stomach so I would have something wrong, which not as a kid, you don't realize that if I have bruises now, my parents might get investigated.
Wow.
But I was like, I wanted something to be wrong with me in order to be costing my parents this money. And I didn't understand my mom was fine financially. Like, she had a good job. That I didn't understand that part. I just knew that doctors were important. I didn't know that she had good insurance that would cover anything, like whatever happened.
Right.
So they put me in the hospital, and because I was getting sick again, my fever was high, and they woke me up at like 4 a.m. because I had an appendicitis. I needed an appendectomy because the surgeon that came in said, you were about to rupture. It exploded on the exam table. Wow. I went into shock. My fever went up to 106. All kinds of stuff went wrong. I had an infection, all kinds of, I have a huge scar because I think it's only supposed to be like a little tiny one. It's about 4 inches across.
Yeah.
And it's not because I don't think it's because I punched myself, but I'm just saying, like, so I've known my entire life that this is the kind of thing that causes people stress, causes them to lose their homes, not be able to afford the education they might dream of for their kids. So it really I don't know. Like there was a moment in the 90s, and I do think it was a mistake for Clinton to put Hillary in charge. Remember, he put her in charge of healthcare, and the Republicans already hated them. So I don't know if it would have been different, but it certainly didn't help things to put your wife in charge.
Yeah, she was resented. And and the misogyny in this country is is still so. I mean, it's still so strong today, but back then it was pretty blatant.
Yeah.
Yeah. So no, I agree. I mean, that was a moment where we could have maybe really gotten something done. I think that Obamacare was it was a compromise.
Which doesn't help us.
It helped. It got like 30, almost 40 million people insured. So, I mean, that every little bit helps.
That's true. That's it. Yeah.
So it's better than nothing. But there's still a large segment of the population that they don't qualify for Medicaid. They still can't afford Obamacare, and they don't get insurance through their employers. And there's a lot of people that slip through those gaps. It's not. Our system is full of holes.
Yeah, it really is.
It's holy. Not in the kind of way you want it to be holy.
Swiss cheesy. We have a listener, Mark says, the Democrats should make the midterm election a referendum on health care. It's a very simple message. They gave your health care money to the billionaires. I don't know if the Democrats are smart enough to communicate this or if the public is smart enough to realize that's what's going on.
I would hope so. Certainly, the people that's what I do all day. So the people I talk to, they're very aware, and the struggles that we have trying to get people what they need. And I'm online all the time looking up their insurance plan to figure out which hospitals they can go to, because it's so difficult to get through the phone to any of these insurance companies to verify your coverage. I'm helping people find applications for charity care at major hospitals, which, thankfully they do. I don't know if people know this, but hospitals in the state of Illinois, as nonprofits, don't pay any taxes. But what they did work out as a deal years ago with the state was that they would provide the same amount, an equivalent amount of money in charity care, equivalent to what they would have paid in taxes, which nobody monitors.
Right.
So, if you need care and you're really struggling financially, please go to the websites. All the major hospitals in Chicago, they all have a charity program. Go to their websites, download the applications, and apply. And you depending on your income, you can get free care. Anything that you need at that one hospital is completely covered, or at a significant discount.
Well, and that's something that I think I told you a while ago, but with the research that I do with my day job, is I was really surprised. There are hospitals, in particular ones that are on extremely expensive property, have a deduction.
Some really pricey real estate.
Yeah. And so in exchange for not paying the kind of property taxes they would have to, they are supposed to provide a certain number of a percentage of their care to those who can't afford it. And they don't even come close because people don't know.
Probably not. So if you're out there, and Northwestern in particular, I know
that's the one I was talking about.
They do provide coverage for undocumented people.
Yeah, and so people need to know that. That's the part.
Not all of them do. So.
Excellent. It's good to know. Another list. Allison asks, so you can keep the campaign money even if you don't get elected? Yes. If you run for office, you open a political action committee. That's a PAC. And so that it's kind of like starting a small business is kind of the way I try to think of it. And the people who contribute to your campaign are helping you get your business started. And they might get a return on that by you getting elected, or the business might not go anywhere and they don't have that back. So I try to use the money to reflect what I would have run for, what I would have done had I been in office. So
you mean you don't use it to go to Hawaii?
No. You can pay. Apparently you can pay yourself. That was something that somebody asked about earlier on, and so I have never done that. Yeah, it's all going to.
It seems unethical somehow.
To be able to keep the money, be able to pay yourself again as an employee. I don't really know how that works. 'Cause I never paid myself.
I suppose when you're running for office, you need an income because you're not doing your day job.
Some people are doing their day job and still drawing a check. Yeah, if you're running hard, you probably can't. Or take time off or whatever. But you also I use some of the money to make sure that people. I use a significant amount to make sure that the people on my campaign were paid because they had worked really hard and were committed to the vision.
That makes sense.
Another listener. Oh, let's get to Dan. Dan in Indiana. Hey, Dan, you're on with me and Dr. Kathy Tynus. How are you doing, my friend?
Hello. Good afternoon.
Good afternoon.
How are you ladies doing?
Very well. It's a beautiful sunny afternoon in Chicago. Thank you.
Yes, it is. Yes, it is. I have a comment to make about what I just heard about. Well, first of all, I am on Medicare, but about Obamacare.
Yes.
The thing about Obamacare is people don't understand it has another name in every state, but it's still Obamacare. My ex-wife had 2 hips, 2 knees. My son had stomach surgery, back surgery, you name it, and it was all because of Obamacare that it was covered. And they still, to this day, do not understand that.
What is it called there?
Well, it's in Nevada. I'm not sure what it's called there, but every state has a different name for it. And you can still find people, and it's the same thing with Medicaid. I mean, it's the same thing with Medicaid that it's called. People still tell me to this day, I don't have Medicaid. My own stepson tells me that.
Right.
I have a different, I can't think of the name, but you try to explain to these people that if it wasn't for Medicaid, and if it wasn't for Obamacare, they would have had nothing. And that's exactly where that's exactly where we're headed back to again. You know, it's just terrible. It's just terrible.
It's all about the labeling, and
it is.
They don't want people to understand where the funding for their health care is coming from. I mean, if you're not getting your health plan from your employer, who do you think you're getting it from? Right?
Exactly.
I mean, come on. But people, want to willfully believe what they want to believe. In Chicago, it's called county care. County care covers a lot of my patients, and that's a Medicaid plan, and it's a managed care Medicaid.
Exactly. Yes, and then I can't think of it at the moment what it's called in Indiana, but also in Nevada, they all have different names. All it is, and I've tried to explain this to them, is it's the person that is, or the company that is administering it.
Right.
And they cannot understand that. There's just no way. And there's some messaging there that needs to go out.
Is it called Healthy Indiana Plan? Does that sound familiar?
That sounds familiar. That probably is it. Yes.
Yeah.
Yeah.
You're right. I mean, a lot of folks.
But if I tell my stepson that, he says I don't have Medicaid. Matter of fact, he says he has Humana, as I remember. I think it's Humana that is administering it.
Right, and that's the thing too, because you can choose which when you get the information from your state healthcare provider. I don't even know how the insurance marketplace through ACA, the Affordable Care Act.
Yeah, and I've tried to tell him when this disappears next year,
that's it.
Don't have that anymore.
Yep.
But you cannot get this through to people, even in my own family. I mean, the messaging is very lacking here on trying to get this across. And it's the same thing in Nevada with the family that I have out there. It's just ridiculous. But I understand completely that the only way people are going to understand what's going on is when it's gone. And when they're hurt, and when they have no more SNAP.
They purposely delayed the cuts in Medicaid until 2026.
Exactly. Yeah, just for that reason in particular.
Right.
Yeah. Oh, man.
Anyway, I just wanted to vent a little bit. I appreciate it.
Yeah, of course.
The last guy, matter of fact, the last guy that was talking about Raja, Krishnamurti.
Yes.
He is way off. This is a good man. I've met him.
Well, I think he's. I mean, I think we can, see legislation that doesn't reflect what we had hoped and expected from people that we do admire, right? And that'll stick in your craw, especially if it's something that affects you and your community personally. I think that has a lot of impact. So
yeah, and we have a congressman here, Frank Mervan. Frank Mervan, excellent man, took over for Pete Voskowski after 20-some years. Worked hard for the steelworkers, everything. Now they're going to get rid of him because Governor Braun, is going to redistrict us also. So he's going to be gone.
Oh, boy.
Yikes.
This is Indiana's in on this, too. It's not just Texas. They're doing it as we speak.
No doubt.
I have a quick question for you, my friend Dan. How are you?
Yes,
how do you tune into our show? Online, or can you hear us through regular radio?
No, WCPT.
8:20 a.m.
Listen to it every day.
Excellent.
Yes.
Wow. I'm glad to know that we got folks in Indiana listening on the radio.
Awesome.
I'm so glad. I would love to hear from you, during the week, too. I'm on 5 to 7, so it'd be great to hear from you again.
I'm on it every day, one time or another. Thank you.
Same way. I'm the same way. Take
Have
care,
a good
Dan.
day.
Take care. Yeah. Oh, man, it's so frustrating. Because in Illinois, we have trigger language in legislation that if the federal funding drops below a certain level, I think it's about 330,000 people who receive subsidies for the Affordable Care Act will be automatically dropped.
Right. Well, January 1st, some of the tax credits, some of the enhanced tax credits that were put in place during the pandemic are going away. So the cost of the plans is going to go up significantly come January 1st. And that's if you still can afford it and still qualify for it. So
oh, man.
Either way, it's going to be bad. That's why we need Medicare for all. And I think that's what the Democrats should run for.
Yeah.
So I'm a member of a group called Physicians for a National Health Program, and they've been around for decades, founded by, or at least one of their early members was Dr. Quentin Young. He's pretty famous in local Chicago, Dr. Folklore. And, he was at County Hospital, and he led the charge to say, we should have universal health care. We should have a single payer system. And that translates into everyone should have Medicare. Mm-hmm. And when Medicare was first proposed, it was meant to be a comprehensive program. But, as the sausage making goes, in order to get it passed, they only are covering retirees.
Right.
But it should have been comprehensive for all of us. So there's no reason why we can't have it. There's no, people talk about the cost of health care. Medicare, traditional Medicare, has the lowest overhead costs, 2% administrative costs. Any other health insurance program, 20% administrative costs. So if you really want to save money in health care, you stop paying all those middlemen and administrators that are busy denying your care.
Right. Yeah.
Right.
But nobody wants to get rid of. They have so much money with their lobbying
and they
arms.
Advertise. I mean,
yes.
they're spending all this money to advertise how great they are. Blue Cross Blue Shield, Humana. They got posters everywhere, and they're on buses and on divvy bikes and all that. I mean, where do you think that money comes from?
Exactly.
It's not going to. It's not going to the hospital.
Nope. The desire to keep making more money.
Yeah.
One of the let's talk for a moment about crime in Chicago, because I know you've also done work on gun violence and how that is a healthcare crisis, and there hasn't been anything done because they wouldn't even do research on this, especially under Trump's administration the first time, and now he wants to send in military presence for issues that have gone underserved and underfunded for decades.
The crime rate in Chicago is going down, just like in D.C. I think it's down, 20-something% this year. I mean, the pretext is ridiculous. He wants to create a police state. He wants to bring in thugs to intimidate us, to make us fearful. And that's what they're trying to do in D.C. And I don't know how that's going to work in Chicago.
I don't know.
I don't know, man. I think they're going to get a rude awakening. At least I hope so. least I hope my Chicago peeps are gonna be out there on the streets and give them an earful.
Exactly. And a listener asks, because you mentioned earlier you're with a group of doctors that are fighting for healthcare for all. They were asking about that when that rally where Trump was shot at, and I know I'm going to get people mad by saying that. I mean, I don't know if you have any thoughts on whether or not he was hit, but that's neither here nor there. But at any rate, I mean, and then treated it with a Kotex pad afterwards.
It was pretty good theater, I have to say.
I'm saying. Well, sadly, and we, whatever way it unfolded, there was an ex-fire chief who was shot and killed.
Oh, yeah.
And a listener says there was a doctor who jumped in who was at the rally. It was an ER doctor who was at a Trump rally.
Okay.
And apparently the victim's two adult daughters at the rally are nurses. Do you have a feel, like, I know that I followed a nurse for a while on Twitter who was a January 6th rioter. Right. Oh. And she got pulled into all the masking thing was bad, which defied logic to me about vaccinations and masks and things like that. Do you have a feel, and this it's hard because I don't want you to talk, like, it's your colleagues. Mm-hmm. So, but what you see online that's kind of shocking, that there are people who were trained in this field, in the medical field, and are buying the lies.
It amazes me sometimes. Doctors are people too. So just as you have, a broad range of opinion within, the society at large, you're going to see the same thing with physicians. And, there's a big divide. When I was president of the Illinois State Medical Society, there's the upstate doctors and the downstate doctors, and there was always clashes going on, and there still are on policy. So everyone's entitled to their own opinion. And,
exactly. Yeah. What can you do about it? And then another listener says that I was the president of the largest medical coding software company. Your guest is absolutely right. The only hope for the country from a financial and coverage perspective is Medicare for all, 2% admin costs.
Mm-hmm. Yeah. Absolutely. Thank you. Thank you. I'm telling the truth, and I'm talking about the facts of the matter. The Physicians for National Health program has a great website. They have much more detail about the financing of healthcare. PNHP.org, I believe. I should double check. But it's a fantastic organization, and I know there are plenty others out there as well. But I think the time has come. I think we talked about this before, that the pendulum swings. And it has swung so far in this crazy direction that I think it's time for the pendulum to now overcorrect and swing very far once, hopefully, please, dear Lord, once we have some control, and let's make Medicare for all one of the priorities.
I also think that, we were mentioning Trump wanting to have military occupation of Chicago as he has in D.C. And one of the things that he said is he wanted to remove all the homeless people. To your point, as far as Medicare for all, I also think that we should look at other countries that are managing the crisis of homelessness. Like, I believe it's in Finland, where it's called housing first. And so a lot of places, approach it as, get people addiction services, get them mental health services. This is about having housing first. There isn't a requirement. When people are able to have a roof over their heads, sleep at night, remove that stress of survival, they're able to find solutions to the problems that they have before them, or be creative about what they want to do with their lives and how they can contribute.
That is a principle in healthcare. At least it's been talked about quite a bit, but you have to have people willing to fund that, and to make that a reality. So, but yeah, that's a strong belief that I have as well. How can you get your medications, take your medications on time? You don't have access to water. You don't have transportation to go to the pharmacy. You're worried if you do leave your tent, someone's going to steal all your stuff. I mean, it's ridiculous. It's really sad.
Yeah, and to forcibly remove people, whatever you have an issue with the way a city approaches the homelessness and people who are struggling, yanking them out of tents, forcibly dragging them is also not the solution. Exacerbating a situation that is already vulnerable.
And doing what with them? Where are they going to go?
Are these also internment camps?
Right. I who knows? I have no idea. And what are they doing with the people they're taking now?
They've criminalized homelessness. I mean, the Supreme Court essentially has said you can criminalize homelessness.
Sad.
Really uplifting. I think hopefully we can, before you go today, hopefully we can end on a good note. But I want to continue our conversation because Jeanette is calling from Chicago to talk about healthcare in the U.S. and in Europe. How are you doing, Jeanette?
I'm doing very well, thanks. How about you all?
Doing well. I love the sunshine today, and I'm in studio with a good friend of mine, Dr. Kathy Tynus. What do you want to share with us?
Well, I was visiting family in Germany and earlier in the spring, and unbeknownst to me, I was taken to a place where they were having a little wine tasting by the Rhine, and there were two opera singers there. Well, they turned out to be American, and they were living there, husband and wife. They were living there and for 12 years, and they were expecting their second child. And I asked them, what do they like about living in Germany compared to the U.S.? And they said, well, first of all, the work-life balance is much greater, better balanced. And in that you get, in the first year of working, you get 4 or 5 weeks paid vacation. You get a supplement for having children, each child. It's not, so that you can lay around, do nothing. It's so that they know that children are valuable and you need extra help. And that the first birth was cesarean and the second one was going to be cesarean. I asked, well, what did that cost? And they said nothing. Yeah. It's all covered here. It's all covered. And nobody goes into bankruptcy there because of health coverage.
I read a book comparing different healthcare systems around the world, Germany being one of them. The German people decided a long time ago that everyone should be covered. And they have a hybrid system similar to ours where their employer will cover. If you work, your employer will cover your insurance. But if you don't work, no one is left out. So if you're not getting your insurance from the employer, you get it from the government. And they decided that a long time ago because, as one of the members of their legislature said, because it's the right thing to do.
Yes, exactly. And I asked, well, what would it have cost you in the States? She said somewhere between $10,000 and $30,000, depending on where it was done. Yeah. A cesarean birth.
Yeah.
And how many people do you know that could afford that?
Right.
I don't know many people.
No, certainly not a young family. No.
Yeah. Yes.
So it's like either have a child or put a down payment on a house. You can't do both.
I'm getting a lot of. I have friends who bought a condo in Portugal. I have a friend who is moving her parents to Mexico, to Merida, Mexico, and I know a lot of people have thought about it. It's one of those things where you go, if you can. It looks like some people are taking the opportunity.
Mexico, in particular, their new president, Claudia Sheinbaum. Mm-hmm. She's fantastic. She's tough. She's progressive. I'd move to Mexico if she was my president.
I'm considering moving to Europe. I watch a woman on YouTube, a single woman, 70 years old, moved to France.
Yep.
She gave up her Medicare. She doesn't plan on coming back. She gave up her Medicare because she can get health insurance coverage for less than what she pays for Medicare.
Mm-hmm. Yeah. That's fabulous.
And, we're doing it wrong here.
Yes,
is what it is.
Yeah, I love Chicago. I do love my country. I love my family, and I want to survive and thrive. Mm-hmm. And sometimes I think about it. I don't know if I have a kind of profession. There's not really much progressive talk show opportunities in Ireland or.
Well, you might be surprised. When I was over in Ireland before I was in Germany, they had a really strong protest for and rally for the Palestinians having legal rights. So they're very progressive there.
What I should do is find out if there's a radio station that would just carry my show like in the middle of the night and try it out that way.
There you go.
Right?
There you go.
That's kind of what I do in Seattle and Minneapolis.
Sure.
Oh, wait
You
a
can do
minute.
it remotely.
I think this is what we're going to do. How do I get that done? Jeanette, thank you for the...
Well, and you can do the radio show from anywhere. You could live anywhere and do the radio show, right?
Well, you
Exactly.
can
I
do
love
this
that.
show from Ireland. So.
Exactly.
Yeah,
Wait a
there you
minute.
go.
Wait a minute. Thank you. Jeanette, you've sparked an idea. I appreciate that. It's great to hear from you. Have a wonderful rest of your weekend.
Thank you. Have a lovely weekend. Yes, thanks so much.
And as I always say, stay hydrated. That's a thing you can do that's immediate
Me too.
and self-care.
I do.
Yeah.
Yes.
Yep. Stay hydrated, my friend. Take care.
Okay,
well, Doc, it has been a pleasure having you in studio.
My pleasure.
I believe we're going to welcome in. We're going to have Warren Preis. You don't remember if you ever met him at the other station?
I don't
my
recall.
late night guests. We used to come in so late. You're very generous always with your time, and I want to thank you for the way in which you treat everybody with respect, with dignity, whether they're a patient or somebody who has a question. You really I don't know how to say this, but you basically it sounds gross. You ooze kindness. I mean, it's just like...
Is that what that is?
It's oozing.
Ew,
you emanate? You not emanate. What do I want to say? I don't know. You glow with kindness.
You're
That's
so
better. Glow. I want to say you glow with
sweet.
kindness. That's probably better.
Thank you
I just
so
remember
much.
when we, like I said, when we reconnected years ago, I was like, I need this person in my life more often.
Amen, sister.
So thank you so
Amen.
much. And maybe we go to New Orleans for Halloween.
Sounds
I
good
mean,
to me.
I'm just saying.
Okay.
We're going to take a break here and continue our conversation. We come back in just a little bit. We're going to have with us Warren Preis from Source Solar, sponsor of the Driving It Home with Patti Vasquez show. This is Patti filling in for Edwin Eisendrath. We're so thrilled that you're here. Hope that you are happy, healthy, and safe. And again, go to Alivio.
Alivio.org.
It's alivio.org. ALIVIO.org to learn more about the great work that they do there, including Dr. Tynus. Thank you, everybody. More in a moment.
Facts matter now more than ever. This is WCPT 820, Chicago's progressive talk. We're your source for truth.
NBC News Radio, I'm Lisa Carton. President Trump is praising Texas Republicans hours after state lawmakers approve new congressional maps that could give the GOP 5 more seats in the U.S. House. In a post on Truth Social, Trump singled out Texas Lieutenant Governor Dan Patrick for his, quote, terrific and powerful leadership in today's final passage of the bill, calling it a huge victory for his America First agenda. Kilmar Abrego Garcia could soon be deported after being released from a Tennessee jail. Attorneys for the famous immigrant were notified Friday that he could be deported to Uganda as soon as next week, even as he awaits trial on human smuggling charges. After his release yesterday, his lawyer said Abrego Garcia was on his way to Maryland to reunite with his family. He was originally deported earlier this year in what the White House said was an administrative mistake, but then they later claimed he was a member of a crime gang. The Abrego Garcia case has become a flashpoint for President Trump's immigration policies. Louisiana officials say a fire at a manufacturing plant continues to burn today, and a mandatory evacuation order within a 1-mile radius of the facility remains in place following a powerful explosion on Friday. Officials said as of today, 42 people are in shelter. No injuries were reported, but Louisiana State Police urged people nearby to remain inside and avoid contact with soot from the fire, which may contain harmful chemicals. A suspect is being held after an early morning burglary attempt at the Beverly Hills home of singer-songwriter Lionel Richie. Police were called to the home just after midnight Friday to check on a report of a stranger on the property. The 76-year-old music legend was at home at the time, but no one was hurt and nothing was taken. You're listening to the latest on NBC News Radio.
This is Chicago's Progressive Talk, 820 AM, WCPT Willow Springs, and online at WCPT820.com, where facts matter. Hey, Google, play WCPT.
Streaming Chicago's Progressive Talk from TuneIn.
You're listening to The Big Picture with Edwin Eisendrath on WCPT 820.
Well, I hope that you're not disappointed that Edwin Eisendrath is off. Well, I hope that you're excited that he's taking a day and relaxing, hopefully. This is Patti Vasquez filling in for Edwin Eisendrath and The Big Picture. I am the host of Driving It Home. With me, Patti Vasquez, Monday through Friday, 5 to 7 p.m. And one of my regular guests and sponsor of that show from Source Solar is Warren Preis. Hey, Warren.
What's up, Patti? How are you?
I'm good. Warren is also my car guy and helps me out whenever. Ex car guy. He's my ex car guy, and I always have questions for him. We were just talking to Dr. Kathy about her talking to folks about
she
solar
said she had
panels.
a 4-story property on 15th Street. And she said she explored it, and I said,
Try again.
The height isn't the issue.
Shouldn't be an issue.
And that, 4 stories is 5 is about tops, but 4 might be able to work.
Yeah, it might be that the company just didn't have.
We're going to explore it. We're going to find out. I'm going to plug her into Google Maps and zoom in on a roof and take a peek.
There you go. Well, there you go. That's perfect.
That's what we try and do before we, start, throwing the curves and the pitches and the sliders and stuff.
Yeah, you gotta be ready. I'll be ready to catch. And I always wanted to be a catcher in baseball.
Well, you were a baseball player, weren't you?
I was a baseball player and
Lane
softball
Tech,
player.
right?
Yeah, played softball at Lane. I played baseball at Norwood. Yeah, I played for 4 years.
I was at River Park.
Okay,
when I was a kid.
What position?
At third base.
Oh, all right.
Yeah.
Oh, hot corner over there.
Yeah, I lived across the street.
All right.
The River Park is now my campground. I lived there for years and years. That was I stayed there more than I did at home.
I was at Norwood all the time. Between the pool and playing baseball, day camp, I love Norwood
Every
Park.
sport. And then we had the guy in the woodshop, Mr. Katie.
Woodshop. I forgot about Woodshop. It's funny that we're talking about parks because I know you have a friend who's going to call in a little bit, run for the parks.
But Richard. Hi, Richard. You listening?
Yeah, the parks were such a big part of my life. I mean, I still drive. I live within blocks. Do you live very close to the park you grew up by?
Not anymore. No.
Where's River Park? I don't know where that is.
River Park is on the corner of Francisco and Foster.
Okay.
Okay, and I live 2912 West Foster.
Yeah, so
There's four buildings from the corner, right across the street. I could look right at the swimming pool, tennis courts, baseball fields, football fields. That was my front room.
Yeah, that's great. We live across from a park now, which was great for the boys. It's a smaller park. Norwood Park is huge. It's not Horner Park huge.
Horner Park is a monster.
Huge, yeah. It's a beautiful park, and they've done so much with it too, with a lot of the different sort of the agriculture there.
They have
and
the
California
horticulture park, or what's the park just north of that? California Horner. They've got the dog walking thing on Irving Park.
Okay.
Yeah, it's awesome. They've got this huge area just for dogs.
Yeah,
and people are out there.
Yeah, and I know that Congressman Quigley, who you also know and have worked with in the past,
very well.
He has been able to secure a lot of financial support for parks, for a lot of updating the buildings, but we still have a lot of work to do, obviously, to make sure that we have access to these beautiful.
And I think.
We have a guest
to call in.
We have a guest that's going to come on in a little bit to talk about fundraising for the parks. And the Chicago Park District is a huge part of my life. I was a lifeguard for 2 years at North Avenue Beach.
I remember.
I loved working there.
Just for the kicks,
he may be calling.
Is the phone number 773-7?
Oh, us 773-763-9278. Yep.
Oh,
someone's calling right now.
Richard Saltzman.
Is he a 312 area call?
312? Yeah.
We'll see in a second.
No.
Don't put his number out on the.
Well, I'm doing the last.
Don't do that.
Well, okay.
So before we, Richard's on the line. Let's get Richard to talk about this event coming up because we have time, my friend.
Yeah, we do have time.
Richard Salzman, how are you doing, my friend? Hold on. Wait, I'll get you. There you are. Hey, Richard.
Yeah.
Hey.
Hey, Richard.
Hey, Warren.
Yeah, and Patti.
Hey, what's going on?
You're on the air. You're on WCPT. We were just talking about the Chicago Park District, and Warren tells me you have an event coming up you would like people to know about.
Yes, I do. It's on September 14th, and it's going to be at Burnham Park, which is 31st Street. It's September 14th, Saturday, from 9 to 11, and it's a 5K race. Run for the park. It's the Park Foundation to give back and to help plant trees and keep beautification of the parks.
Wow, that's great, Richard.
Yeah, this is our third year we're doing it, and it with the signing up with the event, you get a T-shirt. There's a pancake breakfast. There's actually a beer truck, and lots of giveaways, and you get a T-shirt. It's a $35 sign up.
Nothing.
And and it's events at Chicago Parks Foundation.org. Events at Chicago Park Foundation.org.
And Richard, you mentioned that this is the third year you've done it. You're with you Banner Wholesale Grocers. You guys are sponsoring this event?
Yeah, this is the third year that we're sponsoring the event, and actually next year we're turning 100 years old.
Yeah, they're having their 100-year anniversary.
For Banner?
Yeah,
Banner's 100-year.
Yeah.
Richard's third generation.
Yeah.
Holy cow!
And he's got his fourth generation working with him now.
That's fantastic. Tell us the history of Banner Wholesale Grocers. How did this great company start?
It was back in 1926. My grandfather had a small grocery store and decided to buy in heavier amounts and start wholesaling for other retail grocery stores. And it's involved over the years. We were tobacco distributors. We were into a lot of collectibles, and now I sell Mexican and Central American products.
I know. I was looking at this. I'm looking at this piñata. I'm like, this is fantastic. I mean, so it looks to me like it's like a big warehouse, like kind of like
it's huge.
This is like before Costco. There was Banner Wholesale, right?
Yeah, no, it's definitely a span of Costco, and
it is.
We do get. We have a cash and carry that's open from 5 in the morning till 2:30 in the afternoon, Monday through Saturday. So anybody can come over and see what we got. We also run little things on TikTok. We always have something going on social media.
I love that. For folks who are curious, it's Banner Wholesale Grocers at 2639 South Damon Avenue here in Chicago, and I love that. I as a Northwest Sider, I'm terrible about going to, but I will drive to Banner
Do you know where
Wholesale.
all the foods come into Chicago around 26th and
Sure.
Damon?
Yeah.
He's got a building right outside of theirs that's similar in size.
It's like you're environmentally friendly. You get
he is
all the food.
environmentally
All the
friendly.
food comes in. You go over, pick it up. You're right there.
Yeah, it's
I love
fabulous.
that.
Yeah. Actually, if you come in, we have a taqueria on the premises. So
Now you're making me hungry.
I'll meet you down there for lunch, Patti.
Let's do it. I want to do that. I love that you're sponsoring this 5K run for the parks. How did you get involved in that? Did you grow up going to the park districts too?
I think it's a little bit of having a little success and giving back. So I've known Willow Lang, who's the head of the Park Foundation, and she got me in by my heart, and I said, yeah, let's do this, and we've been looking forward to it every year. We're looking really forward to it next year because it kind of ties in to our 100th year anniversary. So, it's been a really good relationship.
Richard, what did you guys do? Also, you fixed up the area on the south end of your property along the Chicago River.
Yeah, we're on the south branch of the Chicago River, right on Damon, and we built this small river walk behind it. Kind of extends. A few others have it, so it extends for just about a half a mile. But it's nice to see that anybody
he put that in for
for
the neighborhood.
If you're going to build anything on the river right now, you have to do that. So it's good. It's all good.
So you mentioned that you're also you got your fourth generation now helping with the business. So are they the ones running the TikTok account?
Yeah, Ryan is Ryan's my son. Yeah, he really it's been a good. This has worked out very well for us. He's really enjoyed making these.
He's bringing in his knowledge and talents into your business and expanding upon what you've developed already.
Yeah, I love that.
Yeah. Well, you got to keep fresh, and you got to keep now. That's how I guess we survive for all this thing.
Absolutely. Now I have a question for you. Are you going to be running for the Run in the Parks? Run for the Park?
Well, I think that there's a second thing besides there's a nature walk, and a 1 mile nature walk. If anybody wants to do that instead of.
I'm not running, but I'm coming.
But no, and you can run. You can run, you can walk, you can roll. So we have it's a handicapped. It's cemented. So
good guy.
That's recommended.
I love it.
And it's fun though. After the run, with breakfast and then if you really want to have some fun, we got the Goose Island beer truck. So. Yeah, it should be fun.
That's amazing. For folks who want to be a part of it, it's ChicagoParksFoundation.org. Again, ChicagoParksFoundation.org/run to find out about the Run for the Parks. It's a 5K run, walk, or roll, as Richard mentioned. There's also the 1 mile nature walk. There's a kids dash, which is only $15. You can go, you can register, and it's all sponsored by Banner Wholesale Foods on September 14th at Burnham Park, which is at 31st Street, the 31st Street Beach, 3155 South Lakeshore Drive. So it's right there at the beach house. So it's still, with the way we've had our summer, it's certainly going to be, I'm predicting
perfect.
It's going to be gorgeous.
It's probably going to be about the beginning of the race. It'll be about 67 degrees. By the time it's 11 o'clock, it'll be about 74 and sunny and gorgeous.
Yep, and then hang out for the post-race pancake party. So if you don't want to run, come get your pancakes. Get your pancakes.
Hey, I want everyone to come. Anyone who's listening, even if you don't come,
support.
You can donate.
Yes,
you can donate.
Support Chicago.
Sure, that's right. We need some more support.
Well, Richard, it's been great meeting you. Please don't hesitate to reach out if you want to send your son our way to talk about the sales and his social media account, or if you want to join us again, we'd love to hear from you.
We'll get him back on the next time we do Source Solar.
Oh, I like it.
Yeah, we're going to put this to bed.
Have you put some solar panels on Banner Wholesale?
What we do right now is we're using our example of what Banner Wholesale looks like for our message to businesses.
Yeah,
that's on our cover sheet. We have
what?
Yes,
that's fantastic.
We're using that. We made out a plan that for Richard's property, we are using that as an example of savings that we show businesses.
So you can vouch for Source Solar, then, Richard.
We're using his paperwork. We're using his paperwork.
I love it. Well, Richard, it was really a pleasure to meet you on the air, and I look forward to meeting you in person sometime.
It sounds great. Thank you so much. I really appreciate it.
Absolutely. Oh, my pleasure. We'll try to get another plug in before the 14th.
Oh, no question.
Yeah.
I'll plug for sure.
I love my park district. Thank you so much, my friend.
Richard, talk to you later.
Take care.
Bye.
Pleasure.
Bye.
Enjoy the day. Bye. That's fantastic. What a great story.
Yeah.
Four generations.
He's got 4 generations in there. His son Ryan's working with him. His son Sammy's working with him. His daughters are involved now. And
that's great.
He's taken the company to a completely different level than the first 2 generations. The first generation was at a level. The second one came in, and then Richard just went from level here to huge. He does a great job for the public.
That's outstanding.
And for the community that he serves.
Well, and I love that he is interested in the alternative energy, renewable energy too. So he's obviously forward-looking with 100 years behind his family of bringing this business to the community and, switching gears and having catering to the Latino community as well.
Oh, my God, yeah.
What? Yeah.
Did
he just text you?
Yeah, he just texted me. He says, that was great, thanks.
Of course.
Richard, pleasure. I love what you're doing. That's all I could say.
That's great. Well, and that's the thing is that people need to know that we've been talking about the Source Solar and the fact that incentives will run out for residents by the end of this year.
Yeah, residents, we're going to run out of people who own homes will not be able to get solar under the program for savings after December 31st. And if you're going to actually get involved with solar, you have to do it before because we have to break ground quickly.
Right.
We've got to go through all kinds of paperwork with the government to get everything passed with the city or your township or county, whatever it is. And then we have to have our engineers produce paperwork to give to them to approve before we even begin the project. And most of the time we have to have the project completed before year end. On the other hand, a year end.
Yeah.
On the other hand, the commercial properties, they have till next year.
Oh, man.
So, but that's also, it's funny. I woke up this morning pretty early, and then I looked at my clock, and it was 2:12, and I had to leave my house to come here. I had no idea where the day went.
Oh, my God.
It was just a blur.
What would you do today?
Went to the gym.
Well, you get up at like 4:30 in the morning, even on Saturdays?
Yeah.
Okay.
Yeah. I went to the gym. I worked out. I met Arturo to do some work at the house. I had another guy named Matt working at the house. And actually, today is we're having dinner at Kim's house tonight with Lily and Claire. Claire just came back from a year's contract she had away in The Hague in the Netherlands, and she came back on last Friday. She started her job on Monday immediately at Rogers Park Montessori, where she went to grade school.
How wild is that?
That's crazy. She went to school there, and now she's teaching there. And Lily is leaving tomorrow for Washington, D.C.
How exciting.
And she's going to the Peace Corps.
Yeah.
So she's going to get a little training in Washington, then she's going to go to Mexico for 3 months and get more training before she's put out into the universe to help the environment.
And she does that for 2 years?
She'll be gone for anywhere from 2.3 to 2.6 years.
Wow.
Yeah, 2 years and a quarter to 2.5 years. She'll be gone.
Man. It's interesting because I remember thinking about doing the Peace Corps, and I don't think that we hear enough about it anymore. Do you know?
You don't hear. You know what you do hear about?
What?
The shrinkage of employees and management.
Yeah.
Because of certain things.
Yeah. There's that.
There is that fear that we have that they might not be strong enough to carry and back up the people that they have in the field. But I think right now they're still strong, and she's got guts to go do her thing, and we're going to let the girl fly, and
that's great.
Help the planet.
Exactly. Yeah.
She wants to definitely help the planet. It was funny, after she graduated from Pitzer, she went to a place in just about 10 miles south of the Arctic Circle with one of her biology teachers from Beacon Academy, where she went to high school, is Dr. Irene Moore, who brought her there, and they spent 17 days there digging holes to do some core work to find out what's going on with the Earth.
Sure.
That's what she was, after she left college.
Wild.
She was there for about 3 weeks. It's crazy stuff that girls are doing.
Yeah, I know. Griffin's in Italy. He's doing a program, Living History, because we're the history dorks in my house.
It's okay.
And so he's
every day we're creating history.
Apparently, we have to keep making sure that people remember what history is instead of what somebody wants it to be. Just saying.
Yeah.
I mean, at any rate, he's so we're gonna. The reason I can't do the run for the parks, is we're meeting him in Paris. I know.
Oh, that's right. You told me about that trip.
Yeah, I saved up $500,000. I didn't even realize it until I started making
miles.
500,000 miles.
They're gone.
Paid for the flights for me, Steve, and Declan, and then for the hotel room in Paris. It's crazy. It's actually I hadn't even thought of it.
You're lucky that's all it's costing is 500,000 miles.
Well, I still have to pay for hotel in Scotland.
Yeah, no, you'll have expenses.
Expensive. Yeah.
Yeah, you're going to still drop a few G's.
Exactly. Stop. I hate thinking of it that way.
G's.
Yeah.
G's whiz.
We did it when we went to London. I survived. It took me a while to pay off, but it was worth it. It's an experience. Your kids are only going to be kids for,
If you don't do it now, you'll never do it.
Yeah, it's his last summer before college. This is it. Just saying.
Just saying?
This is it.
Blink your eyes.
His last year of college, yeah.
Last year of college, he's graduating.
He'll be graduating next year, yeah.
Isn't that crazy?
I know. That's wild.
Oh my God.
Yeah, I know. It was so cool. I mean, it was wild sending him. He's never traveled internationally by himself. So, yeah.
How long has he been there now?
24. Not even. He got there at midnight their time in Florence.
Recently?
Yeah.
Just yesterday?
Midnight, yeah.
Okay, so you'll hear
I dropped
from
him off, yeah.
You'll hear from him for the next few days, then you won't hear from him at all. Because he's going to be living.
I know. What's he supposed to be? He should be living. I know.
Yeah.
We're trying to figure out how often to expect responses to our
Claire
text.
left. She was gone. We didn't hear from her for, we had to call her.
Well, and that's the thing is that when Griffin's at school, like we go for weeks without necessarily connecting.
And he's only at 55th Street.
Exactly.
Yeah.
So it'll be fine. I'm fine. I'm totally fine. I'm
sure, you'll break. I can't wait to see how Kim is today and tomorrow.
Oh.
Yeah. With.
Will you be able to visit? Are you going to go down to Mexico at all? Yeah.
No.
Okay. I'm sorry.
Is that everyone on Facebook watching me? No.
I cannot wait to go back to Mexico City. Have you been to Mexico City?
No. Lily was telling me that I have to go to Mexico City.
You have to go to Mexico City.
Now, I was fortunate enough that for 18 years I had a place in Diamante Beach, Acapulco. And this year we sold it. The reason we sold it is because 2 years in a row we got hit by hurricanes and our property was destroyed.
No.
They rebuilt it again, or started to rebuild it. It got hit again. And then this year there was another storm coming. It passed, and we were fortunate to get something out of it. And dealing with the bureaucracy of insurance, we decided
it was time.
It was time to go recover what you can and move on.
Oh, man.
So we're going to move on, and what I'm going to do is go to Mexico City. And
when do you think?
I don't know. I haven't decided yet.
I'm so excited for you.
Then figure out how to go visit her where she's going to be, which will be several hours away.
Sure.
I'm not going to worry about it. I'll get there.
Can you tell me what part of Mexico? You don't have to.
Well, wait. I can.
That's fine. Cuernavaca?
No, it's not. Cuernavaca would be cool.
I was going to say.
No, that's
I don't know if they need. Yeah, I don't know if they need the Peace Corps as much as other
let's
parts.
See. Lily says it's going to be in.
And I can't wait for you to go to Mexico City.
I'm going to have you pronounce it because you're Latina.
Don't count on me for that.
Oh no, I will.
Just saying, no, you can't.
Yeah.
It took me forever to say some of the, like my mom's from Coahuila, and it took me a long time to learn how to say that correctly. Even my own last name. My mom's like, it's not Vasquez. It's not Vasquez.
What is it?
It's Vasquez.
Vasquez.
I had to promise her I'd work on it. Sorellis, yeah. See, I can't.
It took you 4 weeks to get that straight.
Because it's like solar, right? I kept wanting to do like Peter Sorellis, like solar.
Yeah. Oh, here it is.
Yeah. Oh gosh, you're gonna hand me the phone and let's see. Give me that. I can't see that.
Because of the Q.
Oh, Quitaro. Querétaro.
That's where she's going to be first for 3 months in training, and then they're going to put her out into the field.
All right.
Yeah. So
very cool. Well, when you go to Mexico City, the food is unbelievable. There's a wonderful community. It's like sort of on the outskirts of Mexico City.
There's 30 million people there.
It's a bit much. It's a lot. So that's why I love Cayoacan, which is where Frida Kahlo's house is.
My daughters were Frida Kahlo freaks.
Oh, you have to. I mean, and you have to make. I didn't get to go to her blue house, but I went to her studios where her and Diego Rivera used to do a lot of their work together, and that's across the street from a wonderful restaurant as well. The food, unbelievable. The people are wonderful. There's so many great elements to Mexico City. The parks.
Several people since I've told them that Lily's going to Mexico say. Mexico City, Mexico City, Mexico City.
Yeah, it's funny because I went when I was a kid. And I did not appreciate it. I was 19. I was in love. And I was in love. And I just started dating my boyfriend. And I wanted to talk to him all the time.
Yeah. So you were. Well, imagine if you had a cell phone.
I know, right? I was right. He made fun of me when I came back because I kept writing him postcards. And like one of the places we were was Puebla. Not Puebla. It was. Oh, no, I can't remember. Tasco. Tasco is where the silver mines are. And apparently I kept writing that Tascos are known for their silver mines. So he started making fun of me. I didn't know what to write in a postcard. I felt dorky.
I miss you. I love you. Kisses. Goodbye.
But we just started dating. I couldn't even do that. I just was going on about the silver mines and he made fun of me, which ultimately.
What happened when you came back?
We dated for 18 months.
Oh, that was substantial.
Have you ever seen my stand-up where I talk about how I asked a boyfriend in college, let's call him Tom because that's his name, Daniels, and I asked him one time, how do these jeans look on me? And he said, well, if you don't feel good about yourself, why don't you work out more often? Which wasn't the question I had.
That's not the answer to that. The thing is how do these jeans look at me? They look either fine or they don't.
My husband.
You're talking about the jeans,
yes,
not the body.
He was talking about the butt. So here's, or thighs. So here's the thing and the material that I talk about is my husband knows how to answer these questions so magnificently.
He answers the question.
He answers the question, and this is how he does it. If he likes it, he looks great. And fine isn't great for me. I don't like fine, right? So if Steve doesn't like it, you know what he says? Not my favorite thing on you. Isn't that freaking brilliant?
Yeah.
I like that purple dress you have, or I like, you know what I mean? Like, and then that way it helps me.
But he answers the question.
He answers the question
with no pain.
Yes, with no pain. But Tom was he was a lot. At any rate,
did you have a good time for 18 months?
No, I mean yes and no.
No,
that's off the air conversation. I think I've talked about this before, where like the physical part of it was fun, the emotional part of it was terrible. Do you know what I'm saying?
How old were you?
I was 19. Yeah.
Yeah, the emotional part was really terrible because you were new to all of this. The highs and lows. And
if I said I love, like we were at a video.
I love you. It's easy to say.
No. I was at a video. We were at a video rental store, and I said, "Oh, I love this movie." He goes, "Oh, you love it? Are you in love with it? Do you want to marry it?" Like that.
Bye. That was it.
But I didn't. And like the moment, there were a couple moments that I was done. I was singing in the car, and I don't know music that well anyway, but I was singing, and this one I knew.
You know music better than you think.
But still, I was like, "What's love got to do?" Right? And the radio was on. He turned to me. He goes, "Who sings this?" And I was like, "It's Tina Turner, obviously." He goes, "Why don't we leave it that way?"
I'm surprised it lasted 18 months.
I'm a different person than I was when I was 19 years old. Because
you had more
I was desperate,
tolerance.
I was desperate for love. I mean, there's a point where you think that people, like, especially because I had a tough time dating in high school, because I am loud, I am opinionated.
Out there?
I used to make myself smaller to be liked. That's all.
Interesting you say that, because a lot of people don't really understand that it's not them that you have to accept.
Right.
You have to accept yourself.
Yeah. Who cares what they do or say?
Who cares?
I
They
know,
have
but I
really
didn't
nothing
have
to
that.
do with who you are.
I wanted
You
to be
have
loved.
Yeah, well,
We
I
make
love
ourselves
you.
small. I know, but at 19,
In a different way.
Yeah, I appreciate that.
Yeah.
So does my husband.
Steve, you know I love her.
Let's hit this button real quick because I have to make sure I do our student ID. Let me just. I think it's the only one I have to do. Wait, is this one?
WCPT 820, Chicago's progressive talk, where facts matter.
I might have done that early, but I still have to do it. So there you go.
That's okay.
A little station ID. It has to be done every once in a while. We're in studio with Warren Preis. This is Patti Vasquez filling in for Edwin Eisendrath, who has the day off. I host Monday through Friday, 5 to 7 p.m. And I'm proud to have the sponsorship of Source Solar.
Thank you.
You can go to source.solar and learn more information about the work that they do, because there are incentives running out by the end of this year. And you want to make
Public, get it together.
And the thing is that, like, Peter is so good at breaking down the nuts and bolts of the whole thing, isn't he?
Yes.
He's so kind about it.
I'm along, not for the ride, but for support, because I can do things a lot differently than Peter can on the business level. And Peter has the knowledge of the program.
Yeah.
And what Source Solar is about how to do it.
Right.
He's got the degree in electrical engineering, and he's all of that.
Right.
And we've done over 1,400 installations.
That's amazing.
Yeah.
And I want to say, for folks who are wondering about sponsoring WCPT or my show, that Peter was telling me he's nearly doubled the number of calls since he started sponsoring the show compared to last year.
I'm going to tell you a story. Way back when I was in the business, the car business, and some guy, my twin sister Arlene, came to work for me, and she all of a sudden fielded a phone call that came in from a radio station and said, hey, I want to go to this thing over at the Drake Hotel. There's a thing about cable TV and radio that they want to, show us. I said, go, get out of here. I don't need you to, I sent her away because I hired her. I didn't know what to do with her. She was my sister. I had to put her to work.
Sure.
So she comes back and she says, well, there's these radio stations that are giving a deal that for $3 you get all these commercials, and you can get up
$3.
$3. You get 300 a month from 3 different stations. TBS, TNT, and CNBC. Those were the 3 stations. I said, are you kidding? I said, let's do it. So they came down. We did a commercial, live television commercial. And what was great is the guy told me, he says, in the first time you come on on television, people are going to see you. They're going to call you and laugh at you and make a joke about you. Then you're going to get a next group of people that are going to call with questions. And then the third group, are the buyers.
Yeah.
And it takes 3 months before there's any penetration.
That's great, though.
And
to
it
learn that.
worked exactly the same way. Now, here's what's happening with us. How long have we been a sponsor?
Since the beginning of the year, right? About
a little less.
Yeah.
A little less, but it's taking place now.
That's amazing.
And the public, you hear us? Let's go. Get solar. Let's sky and save some money.
It is amazing when I drive by somebody's house that has solar panels. Now I'm like, I wonder if that's Source Solar. You know?
Remember he told you there were 300 companies and now there are only somewhere around 50?
Yeah.
Because they didn't do it right.
Exactly. That's what I love about working with you guys is that you guys do it right. And like I said, Peter is a patient and he's so detailed about what you need to understand.
Yeah, I
about the
can't keep up
process.
with him.
I know. And he's apparently enjoying his Saturday.
He's out on a boat today. He didn't want to give that
jealous.
up.
That's
fantastic. What did he say?
Well, this is a last minute request for you guys to come in.
Well,
So
what did you
he's
call me
allowed.
Thursday?
Yeah. Yeah, that's when I found out that they needed me. So I'm happy to be here. I have to be careful. I might end up in filling in for folks. But as long as my friends will come.
I filled in for you on this show.
Isn't that great?
Yeah, I was with Jerry.
That's right.
Yeah, how is Jerry?
Jerry's good. Jerry's been running around because he's our beer Sherpa. He has another job. He's a co-producer of the Driving at Home show. So he takes care of all of our social media and such.
Oh, did you get that thing about Richard's
yeah,
charity?
We'll put it up. Yeah.
Oh, good.
Yeah, we'll
Perfect.
put it up and tag him.
He would love that. Yeah. What did Peter say when I said to him, "Oh, I'm going out on a boat.
Yeah,
I can't go."
Have you guys talked about the impact? I know we mentioned it with Peter about the impact of tariffs on equipment and things like that. And not just in Source Solar, but I know you still have friends in the auto industry. Are you hearing anything about what the impact has had on the cost of parts and equipment?
A lot of people are stocking up in fear of.
Yeah, I imagine.
And what actually that's going to do is put off inventories that could be, what's happening, instead of there a flow of inventories,
sure,
that second level next shipment is gone already. So the third load, which is supposed to be the second load, is going to take more time. So there's going to be a gap when there's probably not going to be parts around for certain vehicles.
Folks are going to be in trouble.
Well, yeah, the tariffs are not going to be a sound move down the road.
No. A listener from the 847 says, from Hampshire, my husband says, who sings this song? Why don't you let them sing it? Yeah.
What
Same
song?
thing. Anything. When she sings, that's what he says. Same thing like my ex-boyfriend.
Oh.
So, but I sometimes wonder if do you ever think about choices that you've made and the different, like I do this as a writer. Like I actually wrote a whole screenplay about my life about a character if I had made other choices and if I had stayed with Tom. I wrote a whole thing. It's called Mulligan, and basically
you get another shot.
Exactly.
You golf.
Yes.
I'm golfing tomorrow.
Her name is Katie Mulligan because everyone deserves a do-over.
Okay.
Yeah. So it was basically imagining if I had married this guy who talked to me that way. Like the opening scene is them in a car and she's singing and he says that to her and they're already in the middle of a fight.
How many mulligans have you taken?
And me? I haven't taken. I don't.
Think about it.
But so the concept of the screenplay is that she throws the car. Before we have whatever, but she throws the keys at a moving pickup truck going the other way. They're in traffic on Sheridan. She gets on the bus in front of them, so he's trapped in traffic. She's on Lakeshore Drive on the bus. They have a couple of those. She gets off at Lincoln Park, and she can hear the lifeguard rookies being trained at the Lincoln Park boathouse, and that's the last time she was happy in her life. And she ends up going back and being a lifeguard in her 40s.
Nice.
And that's it was so much fun to write. And I'm probably going to make that one a book because it's just a fun.
Sounds like a good movie.
Right?
Yeah.
It just was really fun because there are.
Barbara Hershey should star in it.
She might be a little bit long in the tooth. I love Barbara Hershey, but that's the 40s.
Well,
Barbara's in her 70s.
Who
Barbara
was in the movie
Hershey
with Bette Midler when they were on the beach? It wasn't
but they're
Barbara Hershey?
Beaches? Yeah,
Beaches,
no,
right.
I'm thinking more like, it's somebody in their 30s or 40s. We're not talking in their 70s. We're talking if they.
It's very funny. I saw Barbara Hershey in what was it? The Lonesome Dove 2, just the other day.
Yeah, I don't see Barbara Hershey climbing into a lifeguard tower at this point.
She'll be hoisted.
No, I want somebody who can still do. So, and the reason why, when I was a lifeguard at North Avenue, my beach captain, Janet McDonough, was 42 years old as my captain, right? So, and we were out running one day, and I think I've told you I hate running. I just every time I go running, I want to go stopping.
You're stopping and running.
Just stop. I'm done.
Okay.
Can I stop now? Am I done? So we were running through Lincoln Park Zoo. She's like, she saw me getting ready for a run. She goes, I'll come with you. And I was like, crap. So we're running. I'm 18.
And
she's
you have to
40.
keep up with her.
Yes.
You can't.
No. So I'm running with, I'm keeping up, right? And we come back over the bridge back towards North Avenue from Lincoln Park Zoo.
Uh-huh.
And at the bottom of the stairs, whenever I would do this run, that was where I cooled down between there and the boathouse.
Wait.
Right? And
John.
she goes, what are you doing? And I go, I'm cooling down. She goes, this is when you give it everything you have left.
Okay.
No, I can't. So and that's what I wrote into the script. This is, but it's actually kind of, if you think about it, artistically writing about that is that just because you've gotten past the hard part doesn't mean you give up now. You give everything
That's
you got
when
left.
you're supposed to push. That is when you're supposed to push.
And so
as a former
runner,
athlete runner,
I was not a runner. I was a sprinter.
You have to, in training, the only way you're going to get better is you have to push yourself to the limit and then go beyond.
Someone just texted, yeah, you do. And that shows what you have in the tank.
Yeah.
Yeah. Give it all you got left.
Yeah.
Yeah. I agree. Listener says, I want to see Margot Robbie play that role in the movie as a lifeguard.
Okay.
Yeah. There you go. Let's get to, Steve in Des Plaines. This is our Steve at Northeastern Illinois University. Steve?
Hey there, darling. How you doing today? It's been a while.
It's good to hear you.
Wait, are you starting over on Bryn Mawr?
Yeah, he's a veteran who's going back to school to study political science in your 70s. Yes?
I just turned 72 on August 4th, I'll be going into.
Yep.
I'm a young 72. I claim that, and
I'm older.
Yeah, school starts on Tuesday.
Hey,
and Patti, I'm going to be taking a real advanced course on FDR. FDR's era. It's going to be incredible. I'm really
excited
looking
for
forward
you.
to it.
Yeah, check out the book.
Yeah.
There's a book by one of my favorite professors, Professor Mark Leff, who wrote a book about the New Deal. So if it's not a sign,
Yes, sounds great.
Yeah, he was such a great professor. He wrote the best letter recommendation. It was very short. He said Patti doesn't speak much in class, but our after class conversations are. I love that he gave me the ding because I was smaller in class, but I was bigger in person. One on one.
Really? Excellent. Yeah. It's very cool.
It's called. Go ahead.
I'm sorry, go ahead.
It's called The Limits of Symbolic Reform, The New Deal and Taxation, 1933 to 1939 is one of his books. There's several others, but it's a really good good book.
Very cool.
Yeah.
Very cool. I wanted to ask the gentleman there, are you the gentleman from Source Solar?
Yes.
Okay. I dabbled in solar sales last year, and I was with Blue Raven. I don't know if you're familiar with them.
No, I'm not personally. Peter might be, but go ahead.
They had a good product, and of course they were talking about at the time they were thinking about saying that the tax incentives are probably going to go away, and now they're going to go away on the 1st of January. Is there anything in the pipeline to bring them back or a modified? Because I'm thinking of getting back in it, quite frankly.
Well, let's go there. So first of all, the incentives do expire for homes January 1 or December 31st, whatever you want to call it.
Right,
so that's number one. And if you do want solar or you're exploring, you better explore now because there's a lot of steps you have to take in order for you to get it and have the incentives work in your favor. Now, if you're a business, then you have expiration December 31st, 26.
Another year. Okay.
Another year.
Okay.
Now, will it come back? Well, let's talk about a new administration, and we're going to have to wait a little bit for that to occur.
Yeah.
So either a new administration or the administration decides that what they've done isn't the best for our portion of the planet. When you hear about I forgot what country it was that just put 1,400 acres into solar. Some country just put 1,400 acres worth of solar just so their people can have reduced electric.
Got it. Excellent.
Yeah.
Excellent. Yeah. Real quick,
take your time.
Are you guys hiring at all? Do you guys hire salesmen or as a curiosity?
Call in. And Source Solar's numbers on the website.
Source.solar.
Okay, yeah.
Uh-huh.
And ask for Peter, and tell him you spoke with me, and you can see.
Okay.
What is your specialty? Residential
Well,
or commercial?
I am. Well, it was homes. I was doing homes in the southwest suburbs. That's sort of the office I was hired out of, and I learned a lot about it. And then the manager of that office got a better deal, and the office closed. Which in sales, things like that tend to happen overnight. So I went there one morning, and the office was closed, and the stuff was gone. And so I went back into my trade. I'm a tuck pointing contractor by trade. I've been doing it for 40 years.
Hey, my dad was a tuck pointer.
Tuck pointing is great, yeah.
Yeah, I'm still doing it, and but the sun is setting on my masonry career, if you will. I mean, I can still do it. I'm lucky. I'm pretty vigorous still, but I'm looking down the road here that I need maybe to move inside and work with my brain versus my back, and especially now when I'm back at school, So. Yeah,
well, here's something you should think about.
If you have, I'll give you guys a call. And who knows?
Hold on.
Who knows?
If you
we'll
have the knowledge, since you've been in tuck pointing, and you have the knowledge of the properties that you've already worked with and on, use your brain and your school knowledge. Circle back, and think of what properties could qualify for solar. And by that I mean, is the pitch of their roof proper? Does it face south? Do they have too many mechanicals on their roof? What makes sense? Do you think the property has a significant amount of electricity usage to warrant even going through the steps to get it? There's a number of factors because not every property qualifies for solar. It's a great idea. I don't have it on my roof because I don't qualify.
I think he hung up because for a minute there it was no, he's still listening.
Oh, okay.
Because you could tell he had the radio on in the car. I wanted to make sure you guys weren't talking over each other, so I had rolled him down, and then so he's listening to the show now. So we want to make sure that Steve goes to source.solar and sounds like I think it'd be amazing to be able to,
if you could pick 20 locations of places that you've been over the last 40 years in tuck pointing.
And this is the week to do it because there's one more week. I mean,
you've got weather. There's a lot of positivity on your side over the next 30 days. But listen, call in, ask for me. I'll call you back. We'll figure out something to make something work if you want to play.
That's cool.
I'm into playing.
Well, like I said, my dad was a tuck pointer. My dad would make his own rigs for hanging off a chimney.
Hanging off, yeah.
Scared I lived at on Northwest Highway near Niagara and Raven, right?
Know where it is.
So I was coming down the alley, and this is when I ran for office.
I'm surprised you didn't go to Taft. You were in Taft's district, weren't you?
I'm not surprised I didn't go to Taft. The kids that used to beat me up at Onahan went to Taft when they went to high school. So I went to Lane Tech. Yeah.
Well, where are they now?
One of them owns a bar over on. It's so funny. I've told this story before. I wrote about this recently. But first, let me finish the tuck pointing thing. I was coming down the alley, and when I ran for office, I mentioned this because my dad. I can still drive around and look at some of the work that my dad did in the neighborhood. Like that's how much I'm a part of this community. Is that my dad helped these buildings, and left his mark there. And so we were coming. There's a bunch of condos right behind Roden Library. It's kind of a yellow brick. Mm-hmm. And so there's a Russell Stevens. Remember the Russell Stevens pharmacies? That used to be remember the RX?
Oh, the RX, yes.
Yes. Was it Russell Stevens?
No.
Not Russell Stevens, RX Stevens.
RX.
Oh, it was one of my classmates. His name Russell Stevens. Anyway, I'm back in my memories. RX Stevens. There was one at Northwest
Pharmacies.
Highway and Raven, and so that building had an apartment above it with a chimney. So I'm coming down the alley from our house, from our apartment, and I see something hanging off the chimney. And my dad had taken ropes and basically taken a lawn chair, taken the legs off the lawn chair. I was just sitting there in a chair hanging off the chimney. And
you were?
No, my dad was.
Your dad was, yeah, of course.
It scared the crap out of me.
He had to get up top to go down.
Exactly.
Yeah.
Oh my God. Just swinging back and forth.
At the old shop, we had a chimney that was 5 stories high.
Yeah.
And it was probably no bigger than this room, but it went up 5 stories, and it was falling apart. How do you think I got rid of it?
How'd you get rid of it?
I got some tuck pointing guys to come.
Yeah.
And then their job was to push the brick into the hole.
Oh, interesting.
Yes.
And does it all go down then into your sub?
It all went into the cellar,
Yeah.
which we had no use at all because it was an old coal burning chimney. And it only went up one story. So all the brick filled up to one story, and we were saved. We closed off the top.
Done.
Done
and dusted.
Yeah, I had one guy give me a quote of $60,000 to remove it. I had it done for $14,000.
Jesus.
Yeah.
That's a lot.
Yeah.
Amazing. We are in studio with Warren Preis. This is Patti Vasquez filling in for Edwin Eisendrath. I'll be back on Monday again. And Warren and Peter, are you guys, do you have time this week?
I'll talk to Peter over the weekend
see
and
if
get in,
Yeah.
before, let's see, this month's over. So we got September coming.
But now if we got any folks that work on houses, I mean, like a tuck pointer like Steve, I mean, circle back.
What about roofers?
Roofers? All the guys.
Oh, Peter just texted me.
He's listening on the boat.
I don't know.
Turn your radio off.
He said, kill it. I said, on the air. That's why I said, yo. He said, what's up? I said, on the air. That's why he said, kill it.
Okay, so he's not listening. Good.
Yeah.
That's better. I mean, not that you can't be on your boat listening to WCPT. If you are on your boat listening to WCPT, text us and let me know. 773-763-9278 on the Credo Mobile phone and text line. By the way, for our listeners, Credo Mobile is offering 25% off. To our listeners, so you type in WCPT25 when you visit credomobile.com. We have another listener with a question about solar. Hey, Bill, you're on with Warren Preis from Source Solar. What's on your mind?
Hey, guys. Happy Saturday.
Happy Saturday.
Hey, Warren, I've called Source Solar a number of times and haven't had any luck. We have a building.
Give me a pen.
Hold on.
Give me a pen.
I'm
going to write your number down. Oh, wait. I can't.
No, not on the air.
Not on the air.
I'll get it.
Yeah.
We're going to get your number, and you'll hear from us Monday.
Sounds good.
Absolutely. Where do you live?
We're in Rogers Park.
Perfect.
We've got two large buildings with that face the sun, large open roofs, and we're also looking to put panels on the sides of the building and maybe generate enough electricity that we can sell it back or feed it back into the grid.
Well, let me explain for a second. Let me explain something. First of all, what kind of buildings are they?
They're brick condos.
They're condos. So it's a condo association?
It's a condo association. We're a nonprofit.
How many units?
32.
32 units. Okay, so the common area. On the common area, you have an electric bill of X.
Right.
You cannot put solar on for 32 units because that's each particular bill has X value. And the expense of expanding that into that type of a property might not work. But if you have
we would still be interested.
If you have common areas like laundry room, garage, hallways, heating, air conditioning for all the stuff, and you have a bill of significance, yes, then we could put it on the property. And the way it works as far as usage, if you're getting more power from the sun, it goes back into the ground, then you get credits that help you for future billing. We'll put something together for you. We'll try and make it as simple and as easy as possible for you to understand. I'm sure you'll understand this.
Hey, Bill.
Sounds good. Yeah, I'd say maybe supplying everybody in the building with free power is a little bit of an overstep. But the common areas, those common, the laundry rooms and the safety lighting and what have you is our prime consideration.
Okay, good.
And Bill, is the number you called in on the one that I can give to Warren?
Yes, it is.
Okay, excellent. I will give that to him. So I apologize if there was perhaps a drop in returning his phone call.
Absolutely,
we'll find out.
I don't understand that.
We'll find out what happened. Yeah,
I don't get that because I can't remember.
But it looks like we're on the right road.
I can't remember not returning a phone call.
Thank you, Bill. I'm so glad you called to follow up with us and Warren. That's great. Thank you.
Bye-bye.
Have a great rest of your weekend.
Thank you, sir.
Awesome.
We'll get you for sure.
Excellent. That's exciting.
Yeah, that's interesting. I'm more interested in is why he didn't get a phone call back.
Me too. I know
Because
you and I are both a little bit. We're both a little bit. Yeah, it's very important.
Communication.
This is a stupid story. It's more about how I feel stupid looking back at myself as a 16-year-old. Do you know those laser zone places?
Yes.
Laser tag. Well, so this was in 1987, right? So
Just when it came out.
This guy Dragos, I think was his name. Dragos. I don't know. Yeah.
Dragos from Sylvester Stallone movies?
No. Yeah, right? I can't remember his first. Anyway, so I was essentially trained to turn on people's equipment, right? We had like this little plug-in thing. It was run by a 6-volt battery, whatever. You know, it was doubled. Anyway, people had like the headpiece. You can get shot in the head. You can get shot in the chest. All that. So I helped people with the equipment, got them out on the floor. So one day I was left alone. There was nobody else there but me. It was kind of a slow night. I guess he figured I didn't need a coworker or anything. I was not at 16. How good would you say a 16-year-old is on the phone with sales?
Not real good.
Not real good. So I answered the phone and someone said, I want to reserve the space for a birthday party. And I said, I don't know anything about that. Can you call back at this time or can I take your phone number? And I was yelled at for not selling like this whole thing. You know, you
Wrong.
told. Yeah, exactly. Like
you weren't hired for that.
Train me how to do that.
First, you weren't hired for that.
16. He chewed me out. This is the why.
How long did you work?
Oh, I don't remember. I ended up being assistant manager for a while.
Oh, okay. So you moved up and then you started to sell.
Yeah, I don't know if I just turning. You know what? There were leagues. There were teams that would play against each other, and this one guy, because I was like essentially had to be like the referee for people. This one guy got mad at me and said that I was an abortion that survived. I was 16 years old dealing with customers.
The guy said that.
I'll never forget that. My friends were all standing around me too.
There's something
vouch for
off the air. I'll talk to you about that line. Oh my God!
Oh, I had somebody say something really gross about me on my Facebook page.
Yeah,
by the way,
I know.
By the way, folks, please no. This one was the best part of me dripped down my mother's leg. That's what somebody posted on the Patti Vasquez Show page. I want to let folks know who follow the Patti Vasquez Show page. We are now actively blocking people who are posting things like that, who are going after, like saying really nasty, racist things. Like the Cracker Barrel thing is driving people nuts.
I don't know about that.
Oh,
yet.
Cracker Barrel changed their logo.
Yes, that I know. I heard.
Oh, so MAGA's losing their mind. And so this one guy, I can't even use the language that he used about what they seem to think is the equal slurs as to cracker. They're using all kinds of language on my page.
Geez. Yeah, I never thought of it. Until you mentioned it this second.
What, Cracker Barrel?
I never crossed my mind.
The Cracker Barrel might be.
Yeah, Cracker.
Well, for decades I've used that as.
But I never thought about it.
Well, they had lawsuits against them in the aughts in 2004 or 5 or so. Like they actually had a policy to not hire LGBTQ individuals, right? So that was part of their policy. That got changed because they were sued, and then they also were segregating black employees. They had whole lawsuits that they had to settle. So
that's crazy.
And then here's the thing, like I understand that people, like I got yelled at one time. I had a joke, and by the way, if you are somebody who takes offense to this word, I am a comedian and I get called all kinds of names, so I also throw back. So anyway, I got called a lot of names in Birmingham, Alabama. I was performing there for 3 weeks. All kinds of names, all kinds of things hurled at me when I was on stage. So when I came back, I wrote this joke that I had to perform in Birmingham, Alabama, and I said there's not enough cheese in Wisconsin for all the crackers they have down there. And I was in Indiana.
That's awesome. That's an awesome line.
And this woman in Indiana, I was doing a retirement home, and I did that joke, and this woman stood up and started yelling at me. She goes, "You don't know where you are," and and I was like, "I'm in
Indiana.
I'm in Indiana.
Yeah.
The birth, like a heavily populated KKK.
You got to be south of Mason-Dixon.
I'm just saying. So at any rate. So for those, and I guess it's, if you take offense to that, I guess look at that. I don't know. It has been turned into meaning people who are racist. That's the way I have understood it for a long time. I know that it was used for poor whites in the South in the 1800s, and essentially, I mean, like it's not. At any rate, Cracker Barrel. So my post was, "Don't worry, MAGA. There's still plenty of crackers in the barrel." And that
plenty. There's so many.
I love like somehow we're supposed to be sensitive with people who like just say the most hateful, nasty, disgusting, and do the most disgusting things, and we're supposed to be like dainty and respectful.
It comes down to
not gonna do that.
What we do with the words that we hear. We can let them affect us, or just know that they came from a source that has no couth. Period.
Yeah, exactly.
Yeah, there's.
By the way, thank you so much, Bob. Our friend Bob said, I enjoy listening to your conversation today. Interesting discussions. Bob, a.k.a. Linear Bob in San Jose, listening to WCPT through the Heartland Signal website, which you can tune into anywhere.
San Jose, like as in
California. One of my favorite places to perform was in Stockton, which is not, so we had to fly from Kearney, Nebraska to Stockton, California. So first it was Kearney to Colorado, so Denver, and then to San Jose. So I get to the San Jose desk at the car rental place, and he goes, the guy looks at me. I don't know why he said this. He goes, what kind of car do you drive at home? And I said, a minivan. He goes, you want a Mustang? I drove a Mustang in wine country. It was amazing.
Convertible?
Yes, it was. I was just like, I felt like I was flying.
Well, no, he did the right thing.
Oh my God. Best customer service in the world.
He took what your life was and he changed it for the weekend.
Yeah, he saw a mom in front of him and he said, this lady needs a break.
Yeah.
It was amazing. Yeah.
I love
from
that,
San Jose to Stockton. What is your favorite car to drive? I know that you have
mentioning that, I actually rented a Ford Mustang when I drove through New Mexico with Kim. God, 30 years ago.
It's a great car.
What's my favorite car?
Yeah,
one that runs.
All right.
My favorite car is Toyota.
Yeah, I agree.
The brand Toyota.
Sure.
I just bought a 2015 Highlander. It's the first car I ever paid retail for.
Wow!
I bought it from a friend of mine who passed away. His wife called me, and
that's nice.
It's another story. And I wanted this car because I knew it inside out.
Sure.
I have a 2013 Camry, a 08 Camry, an 07 Highlander. I love Toyota.
I have
just
two.
Run.
Yeah, I bought one from you and one as a recommendation from you.
You still have it?
I both.
Yeah.
Love my cars. Absolutely. I do love the new Priuses, but I love my old Prius.
The new Prius is pretty hot.
Pretty.
Yeah. I don't know if it's got enough trunk space, though.
Oh, for the wheelchair for my son?
Yeah.
We'll figure it out. Warren, it's been a pleasure. Everyone go to source.solar and make sure you make an appointment. If you've been thinking about getting solar panels on your house, it's time to hop off the fence.
Hey, Lily, Claire, Kim, Sarah, everybody.
Thank you, Paul Shivari. It's been a lovely Sunday with you guys. Have a good one. Thank you, everyone, for calling in and texting. Again, Credo Mobile was our phone and text line. Go to credomobile.com, and you can get a discount of 25% over the next 2 years. That's WCPT
Great
25.
deal.
Thank you, everybody. Have a good night. I'll be back on Monday. Do I hit this, or do you take over? I hit it.
From energy to public health, extreme weather, the economy, and more, Climate Connections makes the global local.